Good morning, the Ridge Medical Practice. Vicky speaking.
I got bitten by a dog yesterday.
OK, right.
And he drew blood.
Where is it most sore?
It's hurting in here.
You're such a brave boy.
I lost my husband in end of May. He went in and he didn't come out.
Must have been a shock.
Traumatic. Yeah, it is a shock.
Have you ever had trouble with your breathing before?
Yeah, but not as bad as
Not as bad as this. OK, right.
If I show you pictures of poo on my phone, if that's OK.
How are you feeling about what happened?
I'm paranoid. Really paranoid.
Yeah. Morning, Ebony.
Morning.
Leonie. Oh, my God.
I'm Susan Towers, a GP, but with an interest in skin problems, so that's why your doctor sent you
I
here.
hope you can help me.
So you didn't have any problems with your skin as a child?
On and off.
What did you have?
Patches of eczema, but then more recent, I've had outbreaks like all down my back, all down my legs, and the biggest problem is my ear. I've had that ongoing for over 12 months now, antibiotics, cream, steroids, anything, and it's just not helping.
Is there any reason why you can think that might have happened? Your job, for example, or any hobbies?
I'd say maybe stress-related. I think age thing, getting older.
You perhaps stress more because you know there's more to worry about, don't you, maybe?
Yes. I've had poor mental health, so I've just been getting myself more well.
Right.
So focusing on my mental health, going to support groups and stuff.
OK.
I've been using hydrocortisone ointment on my ear. It itches, so in the night I'm waking up and my ear's on fire, so that's what's been bothering me more lately. This is really bad.
Oh, that's nasty, isn't it? Do you colour your hair?
I have dyed it, but I haven't had hair dye in the ear.
It is leaching out slowly over time, that's why it fades, and so it can irritate you if you're sensitive. Can I look at, what did you say, your legs are bad?
What they are on my legs is more scars.
Let me pull this round.
Yeah. These are the recent ones that I've just scarred.
Okay.
I say they're like cigarette burns.
Yeah, you do have a spotty type of eczema, which some people have.
And these are my old
marks from
scars.
previous, yeah.
But this is why it's bothers me, because it's come
don't
back
want
again.
to.
No, it's scarring me. I'm not sure if you can see if there's any on my back still, but normally I get them all over my back.
Oh, there is. Okie doke, thank you.
Come and take a seat. So this is a new chap, is it?
Yeah, we're engaged now.
OK, so you missed your appointment yesterday for your B12, is that right?
We got it wrong place, didn't we? We slipped up, didn't we?
Anyway, let's see when your last one was.
You won't know anything about diabetic, will you? Do you?
Want to know, yes?
Oh, well, we've come to the right place.
Yeah. Well, I did my blood this morning and I was 17.7.
OK. What is it normally?
One day last week, it came up to 22.
Anything changed in your diet?
No.
You're not having more cakes, biscuits, chocolate, anything?
No, I've been
Eating a few sweets, but...
I've been eating a few, but not a lot.
No.
It's telling tales on you.
I know. Because we go shopping and, oh, a bag of sweets goes in straight away.
I wonder who's putting the sweets in that...
Me.
OK. So just be careful with those.
Yeah, well...
Yeah.
Right.
OK, love, yeah.
Shall we do your B12?
Right.
Where do you normally have it?
Either my left or my right.
Do you think this injection now might bring a blood test down a bit?
This is not going to have anything to do with glucose levels, no.
Oh, right.
So this is like iron deficiency.
Yeah.
I
So
see.
she might get a bit more energy.
Yeah.
I could do
She's
with
full
some...
of energy.
Is she?
We go cycling.
Good.
I went cycling yesterday and I fell off on my bike, look.
Oh, keep an eye on that.
Does it
all
need
right.
out? Does it need
It
out
looks
on
OK.
We're
but
putting Savlin on that.
If it gets more red, more hot, and any swollen, come back and get it checked. But keep it clean.
Right.
Right, shall we do it in your right arm?
Right.
OK.
There goes, there goes.
So relax your arm down, OK? You know it stings a little bit, don't you, when it
Yeah,
goes in?
it does, yeah.
Look at you, fella. Sharp scratch. It's all right. Nearly done. All done. Okie doke.
Thank you very much.
Today. You're welcome. Nice to meet you.
Yeah, nice to meet
Yeah,
you.
and you.
Oh, yeah. She's not just a pretty woman, eh, love?
We'll see you again, love.
See you
Right,
later.
bye, love.
Bye.
Your skin surface is supposed to be like a brick wall, with
Yeah.
the bricks are your skin cells and then the cement in between them. And people with eczema tend to not have quite as good cement as people who don't have eczema.
Okay.
That means the bricks fall off more easily, so your skin tends to be a bit drier and flakier.
Yeah.
You lose water through the gaps, but also things can get in. When something gets through those little cracks and irritates, it irritates you a lot more than it would irritate somebody without eczema.
Yeah.
And that's why steroids are needed, okay? Because they suppress the inflammation. But we don't want to keep using steroids because they're going to damage your skin.
Yeah.
That's why we've got to prevent with lots of moisturiser.
Is it common that? Because people think I've got flea bites and stuff. I've never seen it before.
Well, I've seen it like that. Some people do have a spotty type of eczema.
And why have I only just started getting it?
Stress always makes things worse. We know it affects your immune system.
Right.
Maybe when you weren't so well with your mental health, you didn't look after your skin as well as you do
true,
now. I don't
yeah.
know. It's a
Of course,
combination of
yeah.
things usually. But anyway, now you've got to start.
Yeah,
again.
definitely. Better than you fobbing me off, really, because I was thinking it just weren't curable.
It's not curable, it's controllable.
Yeah. Lovely.
So you've got 2 tubs of moisturising cream, so that'll last you 2 weeks. I've given you this quite strong cream called Cinelar C. I've given you loads more than I think you'll need, actually. It should be loads better within a couple of weeks.
There's hope, isn't there?
There's definitely hope. You're going to get better.
Yeah,
promise.
thank you very much. Thank
You're
you.
welcome.
We have a big problem with his willy with foreskin. Last couple of days he was complaining that it hurts.
Yeah.
And that he feel the pain when he doing wee. And yesterday at school he fell over and he squashed it somewhere. I've been asking him if it was hurting before he fell over.
Yeah.
He said yes, yes.
Yes, OK. Right, let me have a little look at you. Well done.
He come to me yesterday and tell me, Daddy, I have a little problem. Pull his pants down, look, he's swollen and bigger and getting bigger and bigger.
Poor thing. OK, so it's slightly up now. Right, over here onto this little
Chodź,
thing
pani
here,
sikorka
right,
obejrzy
sweetheart?
rybcia.
Over you come. There's a good boy. All right, then.
Oh, that side is worst.
Is it uncomfortable?
It is hurting.
It's hurting. Normal.
I think he squeezed somewhere here, or is it infection or something?
It does look a little bit infected, doesn't it?
Yeah.
I agree. I'd like just pop his things back up for a moment. I'm going to ask Dr. Keris to take a little look at him because that's sort of, well, it's obviously tender, isn't it? All right, I won't be a moment.
Okay.
But it looks like bruised at the base of his peen, like really bruised.
Really?
Like, because they said it was really swollen up.
Okay.
I thought that doesn't look normal.
Right.
So.
Okay, sure.
I don't know if I've been bitten on my eye by something. It's just literally swollen my whole eye up.
And 2 evenings ago, I sat out on 9:45 when it just getting dark. I got bitten by insects.
We're in garden, and Chris stood on a wasp's nest. His whole body's covered in wasp stings.
Whatever it was flew on, bit me there, and carried on its way.
Well, I came in last night because I'd been bitten. It happens this time every year.
Oh no! I keep getting bitten by something everywhere, look. I've had one there and one there, but I don't know what it is. It's proper doing my head in.
Right.
I got bitten by a dog yesterday.
OK, right.
And he drew blood. And the police suggested that I come to see the doctor.
OK, so tell me what happened.
I'm walking down the road and there was this woman standing by the car, husband standing there and her son with a dog on the lead, a little rat on the lead, yeah?
OK, yeah.
Suddenly just jumped up and bit me through the leg.
Right.
But I was more shocked.
Yeah, of course.
I mean, I love dogs. I've had dogs all my life, but I've never, ever been bitten by one.
The vast majority of dogs are beautiful, nice
Yeah.
animals, you know. Right, shall we have a look at it?
Yeah. I don't think I can get it out far enough.
It's all these new trendy pants that are all tight at the bottom.
Yeah, look. Oh, I might.
Right.
It actually hurts.
Yeah, I bet it does, because it's bled underneath as well, which is that bruising that you can see there.
That really hurts.
Right, there's a couple of things we need to do. Because he's broken the skin, we need to give you antibiotics.
Yeah.
Any bite that breaks the skin, we give antibiotics for.
Yeah.
We need to give you a tetanus booster as
I
well.
haven't had one of them for a long time.
Yeah,
Okay.
I need the top of your arm for that, so if you can just...
Take me jump.
Yeah. Are you allergic to anything?
Not that I know of.
So this will protect you against tetanus for the next 10 years. So
Okay,
that's...
thank you.
Right, just a sharp scratch, sorry. We're all done. That's
Thank you very much.
No problem. And a course of antibiotics to take for 7 days. It's certainly not infected or anything now.
That's good.
It's just about protecting it from getting infected and protecting you from tetanus. 1 4 times a day for a week. That's you sorted.
Thank you very much.
All right, nice to see you.
And you. Thank you
Ooh.
very much.
See you later.
Bye.
OK, I've got Dr Caris in to take a look
Right.
at Philip as well. All right.
Right, so what's happened then today?
He got that problem with the foreskin.
Right, tell us a bit about it. What happened at school then?
I was running, then I fell down.
You fell down? Yeah. OK. Oh, did you land on someone's leg or someone's knee? Maybe. Yeah. We've got to make you feel a bit better, haven't we? Yeah, what do you reckon? Should we have a little look at you? Are you able to sit down? Right. Can you pull the skin back yourself? Is it going to go back? Show us what you can do. OK. Right, there's some bruising. Right, yeah, a little bit. OK. What year are you in at school then? What class are you in?
Year 1.
Year 1. So how many teachers have you got?
2.
2. Right, can I have a little look down here, see if we can make it feel a bit better? Yeah. You're a good lad, aren't you? Where is it most sore? It's just all over, isn't it?
It's hurting in here.
It's a bit swollen, isn't it? OK, you're such a brave boy. OK, did anybody kick you today?
Yeah.
Who kicked you? It's OK, you can tell us what really happened. It's absolutely fine.
Someone kicked me and then I fell over.
OK, where did they kick you? In this bit?
Yeah.
Pull your things up, OK. I think you're the bravest Year 1 boy I've seen today, definitely. Definitely. Right. I think probably he's been kicked there and that's flared things up a little bit and it's all a bit swollen and that's aggravated the problem. He has got a tight foreskin and he may well benefit from a circumcision at some point, you know, where they remove the foreskin to allow it a bit easier.
I'll do a referral and then they can discuss it with you about whether to do it straight away, to wait and see.
You've been ace. Yeah, such a brave boy. Because he's able to pee, we think we probably need to give him some antibiotics to try and help settle that down. You may be more comfortable sitting in the bath, trying to pee in the bath, you know, things like that. Okay. Is that all right?
Thanks for the
all
help,
right,
yeah.
I'll leave you in very capable hands.
No, okay, thank you.
Any questions?
No, I think we know everything.
Yeah, there we go then.
All right,
okay.
thank you.
Thank you. You're welcome.
Bye-bye.
Bye-bye.
All right, see you, bye.
Okay then. Bye.
There medical practice, Dawn speaking. I'm afraid our system has crashed at the moment. We're not able to do anything. I think it would be the same at our other surgeries as well, yes, because we all use the same system. We are advising people if they could call back in about an hour or so. No, I'm afraid I can't do anything because none of the doctors can get onto the system either. I can't physically get onto the computer to see the appointment system. I would advise you ring 111. As I said to you, before the systems went down, I knew that all the appointments for this afternoon had been fully booked. I'm really sorry, but there's nothing I can do because there's no system. The only option would be to ring us in the morning to try and get an appointment then.
Darina. Hiya. Come on down.
Bit faster. You know, I feel a bit...
You're still walking quickly enough though, aren't you? Hey?
Do you know, Dave, I can't.
Yeah? What's been the matter?
My feet.
Yeah?
Here. when I put in the morning, put me here,
Yeah.
it feel like a sponge.
So is it tender?
Oh, yes, even the painkiller doesn't kill it.
If I press there, is that where it's Yeah. It probably is fasciitis where
Yes.
it's where the arch drops a little bit.
Yes, but
And-
it's the other foot as well, just the same.
Yeah, it's often the same on both feet. Yeah. What commonly happens is if we look at your foot sideways on,
yeah,
that's your heel bone,
yeah.
and those are the bones going to your toes. You'll have this strong,
Yes, there.
this strong tendon that goes along
Yeah.
to form the arch of your foot. And what that tendon does, sometimes it flattens out and it pulls on the bone here and it causes an inflammation of the tendon and around that heel bone. That's the thing that's painful. Yeah. What you can do is buy some supports that support the arch.
Oh, my son's bought me
Yeah.
two.
And the other thing you can do is you can give an injection to that area.
Oh, no, then I shall try with that.
Do you want to try with that for another few weeks?
But you see how thing goes.
Okay. So you were telling me last time about, because when we're going down to see my son
Yes, he's still down there, isn't
in
he?
Sevenoaks.
In Sevenoaks.
Yeah.
It's he used to be beautiful, but he wasn't very populated, I remember in those days. But it was beautiful, clean, part of the countryside.
And why were you down there again?
Because I had relation everywhere.
So you were a guest of Mary Soames,
Yes.
who was Winston Churchill's daughter.
First daughter.
And used to go and stay?
Yes, because Auntie, she was the top chef for them.
What year was this? Was it?
In 1954.
Yeah.
Because we used to say, oh, Bradford is very dark.
So we'll wait and see how you go with the padding.
Yes.
Another 3 or 4 weeks.
3 or 4
Still
weeks.
struggling.
Mm.
We'll reconsider possible injection.
Well, I'll try anything.
Yeah? OK.
Thank you very much for everything. And you look at yourself.
And we'll see you again if you're struggling still with
This. I'm getting old. But no, not
You're still great. Yeah.
Keep on going.
See you later, dear. Bye-bye.
Did you see me at when I was 14? And I thought I looked like a right stunner. I went to my sister's anniversary and she had the album out. That's why I thought to myself, oh, you looked pretty not bad.
Even though you say it yourself?
Even though I say it myself.
That tall, weren't you?
I know, I was actually tall-ish.
Oh, it still looks like you. You were changed a bit.
That's me, yeah. And then look at this.
Yeah, you still, I'm sorry, but you still look good. You were, what, 14 there?
Yeah.
Yeah. You should have seen me up when I was 14.
No, I can't imagine you being chubby at all.
Come on in, have a couple of seats. I'm Dr. Caris. Right, this is Angela, is it? Who have you got with you?
I'm an auntie.
Auntie Linda.
Yeah, they live with me and my husband because
All
my
right.
mum died. So.
All right, OK. Right, what's going on?
I'm struggling to breathe again.
All right, OK, when did...
She's been on for nearly 5 weeks now.
5 weeks, all right.
And
Because
she's
you had...
got inhalers and she's using them, but they're not touching her.
Oh, really? Right. OK, so which inhalers have you got and which ones do you use?
I use that one at night and morning. And that one during the day when I need.
OK. Let's check you out then. Have you had your inhalers today?
Yeah.
And have you ever had trouble with your breathing before?
Yeah, but not as bad as
Not as bad as this. OK, right. Right, let's pop this on one of your fingers, eh? And how do you feel in yourself now?
Just a bit breathless.
A bit breathless, yeah. Because your oxygen level's very good, 99, and your pulse rate is OK. Can we have a quick listen? Is that all right? Able to stand up, eh? I'm just going to have a little tap first, OK? Feel a bit warm, don't you? OK. Just have a wee listen down here, don't mind if I just... OK, that's fine. Have a seat. So, I mean, listening to your breathing, it's very clear. There's no sign of any tightening or asthma there. Your numbers are very good, and clearly you're struggling a little bit. And I just wonder if that's more sort of an anxiety, panic attack type of thing rather than a flare-up of the asthma. Our brains control our body, as you know, but sometimes they can sort of go into override, if you like, and certain things, sometimes for unknown reasons, can start making us feel a bit edgy and a bit anxious. And I think that's probably what's going on. Has anything happened today at school, or that's maybe could have made you feel a bit anxious and things? No. Yeah, panic attacks, they are very common, much more common in ladies for some reason, much more common in sort of your sort of age group, if you like, and it maybe is because there's a lot of changes going on, but also there's a lot of sort of emotional stuff going on and difficult to manage sometimes. There's a phone number we can give you that you can ring, and you can get access to someone who can talk a bit about it. Would you like to do that? I think that's probably the best option, isn't it? All right, any questions from either of you?
Thank you.
All right. OK, we'll get you sorted, no worries. All right. See you later.
Come in. Hi, Mr. Arnott. Come in, I'm Dr. Khan. Come and sit down.
Nice to meet you.
How can I help?
So, Saturday, I went for a drink, went down to Tesco's, went to go buy some more beer. As I was down there, a group of lads ended up chasing me.
Right.
I must have done a good 5-6 miles of proper sprinting, running for my life kind of thing. I've really damaged both my calves, like to the point where I woke up this morning, I couldn't get out of bed.
OK, so now tell me about the leg.
I struggle standing up, walking around.
Yeah.
It's just, it feels like constant cramp.
OK, both legs or just one?
Both.
Right, and whereabouts?
Like, all my calf.
All along there?
Yeah.
And you ran for how long do you think you ran for?
A good 5-6 mile running for a good couple of hours.
And for a couple of hours?
Yeah.
Right. We'll have a look at your legs and sort that out. How are you feeling about what happened?
Paranoid. Really paranoid.
Yeah.
Oh, thanks, Vicky. Just what I
Where would you like me to leave it?
Could you leave it just there? It's going to look at me all morning and remind me of apple juice and remind me to drink.
You've not suddenly started passing stools into your pants?
No.
Is there any blood in your poo?
No.
Heidi's been having quite sort of mucousy poo.
And is it like watery or soft?
It's watery. It smells horrible.
Is, like, a child's poo supposed to be black?
Going to the toilet OK?
Going to the toilet a lot.
Not been any blood in your poo?
Are they hard, soft, normal?
Carry a bag full of poo.
Her poos are just not formed.
Hiya.
Guess I got you.
Moppy.
Go in there. Come in. Hi, honey. Please take a seat. So my name's Dr. Eunice. I'm one of the GPs working here. This is Angelia and your mum?
My name is Amber.
Yeah, hi, Amber. How can I help?
She hasn't been very well. I think she complains a lot about stomachache all the time.
Where in the tummy are you having the pain?
In the middle.
And do you have the pain at the moment? No. OK. When was the last time you had the pain?
About 3 hours ago.
OK. When you go into the toilet, when you're doing a poo, I'm going to ask you some silly questions about poo now. Is that OK? When you're going to try and do a poo, is it hard to get the poo out? Do you have to strain a lot to get the poo out? OK. If I show you pictures of poo on my phone, if that's OK, would you be able to tell me which ones you have? I know it's silly, What sort of poo do you get when you do a poo?
That one and that one.
OK, so when it's this one tells us that you're a bit constipated, OK. Have you noticed any blood or anything when you wipe? Nothing on your tissue, nothing like that? No. OK. What's her diet like?
She eats fine.
What sort of food would she eat?
Mainly containing bread.
OK.
She likes paninis.
What about vegetables, fibre type thing? You're already saying no very much. No, OK. Because I think that's part of the reason. Normally when kids are constipated, usually diet has a big control. So we need to make sure we drink plenty of fluids, but also plenty of fibre, so vegetables and things. Can we have a feel of your tummy? Would that be OK? Perfect. So if you pop up on there, and if you lie back down for me, honey, is that OK? So all we're going to do is feel your tummy. Is that it? That's all we're going to do. No pain at the moment? No pain down there? Bit of pain there, OK. That's fine. If you pop back down there. I think we're going to give you something to help with opening your bowels. So this tummy pain might not be, but it's likely that it's all related to this constipation that you suffer from. What we give you to help with that, we give you some medicine. But actually, the main treatment for it is going to be looking at her diet, make sure you're having the good type of food. I know they don't taste nice. You know, I was horrible when I was a kid with vegetables, but like now I know the importance of it.
Thank you ever so much.
That's fine. Thank you.
Thank you.
Thank you. See you later.
Thank you.
So, okay.
ever so much.
Thank you. See you later.
Still got 2.5 hours left.
Who was?
Me.
2.5?
Yeah, but well, you know what I mean.
2 hours and 20 minutes. Every minute counts. So it's 10 minutes knocked off of it.
Once you're in the hour, it's a breeze.
Oh yeah, no, tell me about it. We've got a temporary registration patient coming hopefully soon.
I feel like if I press these, I'll shoot out of this chair.
Are you nervous about going out or anything like that? Have you been out since then?
No, I was going to get bus time. I couldn't even get bus time. I ended up getting a taxi and...
Yeah, it's a very stressful situation to have been in. I think everyone would feel nervous about going out after something like that.
Talking about traumatic experiences is really helpful. Mental health and well-being is so important, especially in young men. It's just as important as your physical health. Evidence suggests that young men are most at risk of suicide. So if you are feeling troubled, down, anxious, please come and see your doctor. We're here to help.
So your legs and the difficulty with your legs, that's easy for me to take care of. It's how we manage the kind of the impact of being chased by these people.
It's paranoia, like there was someone who knocked at my door today and I wouldn't even go open the door.
Right, right.
Just because 2 months ago I ended up getting robbed at knife point.
Oh, God. Have you had any support kind of through these incidents that have happened to you?
I've done like therapy before. I've been on like all the antidepressants and stuff like that, which in my opinion I don't think they do anything, but...
They don't work for everyone, you're right. And if you've been through an awful situation or you're going through an awful situation, they can never take that away from you. I think there's more going on under the surface. We do have a fantastic counsellor here at the surgery, and she does talk to you back as well as listen. The first few appointments are about listening and getting to know you, but then after that, it's about talking about how to cope with things and how to manage things better. So why don't we arrange to see each other in a couple of weeks after today and make sure that side of things is settling, and if not, we can think about how we manage that.
Yeah.
Let's have a look at your legs. That's what you're really here for, isn't it? Okay. So...
Give me a second.
No, take your time. Right, so if you just lie down on there for us. And I'm just going to have a feel of your legs. Is that sore?
Yeah.
Yeah, they are very tight, aren't they, your legs? Okay. What's happened to these muscles, really? It's just because they're not used to that distance of running, as most muscles aren't. They've become swollen and tender as a result. We need to give you something to reduce all this inflammation down. OK, I'll sort that out. Just come out when you're ready, Simon. I think there's a lot of positive things about you, Simon. I was just thinking about it. You're a young lad. You've been through a lot, you know. It's difficult things to talk about, but, you know, you've talked about them, and I think that's really important.
Yeah, it's hard to speak to my mum about stuff like that, and because she'll worry more than me. And
does she get worried as well?
Yeah.
As mums do, eh?
Yeah, and I don't want my mum getting more worried than I am.
Yeah, I think that's fair.
There's no point putting pressure on her, is there?
You're a nice lad, Simon. Oh, don't forget this. This is the key to your legs getting better.
Thank
All
you.
right, see you in a bit. Bye.
Wonderful, thank you.
I can keep hearing, like, you know, beep noises.
Not sure I can see anything.
It's there.
Right on the...
There, so it's there. Sometimes in the middle of the night, it's like drum beats. I can hear this dum, 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 and then it stops.
Right, I'm Dr. Caris, and we've got Karen knocking around.
Yep.
So...
Sorry, what's your name?
Dr. Caris.
Carey.
Caris.
Kelly.
Caris.
Carey.
Toe your doctor mentioned. Toe your doctor mentioned.
Yeah, I'm not... No, sorry, yeah.
Sorry.
Come on through.
Thank you.
Have a seat, Mr. McGowan. So my name's Gemma. I'm a physician associate student working with Dr. James this morning.
Right.
Are you happy to speak with me first? And then we'll get Dr. James in. Is that OK?
Yeah, sounds, yeah.
Perfect. So how can we help you this morning?
Well, I've gone deaf in this year. Probably about 70% deaf.
OK.
I think I'm bunged up. You know, whatever the word is, congested.
Yeah.
That eye's not The eye's watering as well.
Runny nose?
No, it's blocked.
Blocked nose as well?
Yes.
Are you happy for me to do a few examinations on you today? Is that all right?
Yes, love, yeah.
So I'm just going to start by taking your temperature. So just going in your ear. Go in the good one. Perfect.
Is it?
36.3, that's absolutely normal. I'm just going to go in the good ear first, if that's all right.
Yep.
And on the other side. Tell me if it's uncomfortable or painful.
No, it won't be,
Right.
no. It won't be. No, it's not.
So when I summarise to the doctor, it's the ear that's concerning you
definitely,
most,
'cause,
isn't
well,
it?
even though it's me, and it, you know, like if I go like that,
Yeah. That's what it feels
I
like.
can hear that inside like a right loud noise.
I'll go and knock. I might be a few minutes if he's just seeing
Yeah, it's
someone,
all right.
but he'll come back in here with me.
I can nod off, can I?
Yeah, have a sneak if you want. Right, thank you.
Okay.
69-year-old gentleman, Mr. McGowan. He's come in with 3-week history of gradual hearing loss in his left ear.
Okay.
It's sounding quite like a viral infection. He's got a bit of a stuffy nose, feeling a bit under the weather. Sorry for the wait.
Hi there.
Hello.
It's Dr.
All right.
James. Nice to see you.
All right.
So I understand that your hearing's been down a little bit.
This one, yeah.
Is it always in that one?
Yeah.
Sometimes if you're blocked up in your nose, there's a little tube that runs from your sinuses to your inner ear, and that little tube is blocked up.
Right.
And that pulls the eardrum a little bit down over the small bones of the ear.
Right.
And then that's probably what's caused your hearing to drop down.
Yeah, right.
And it'll probably stay drop down until this clears.
Right.
So it might be 4 or 5 weeks.
All right.
Altogether. Can you breathe in and out?
No, this nose is... I can there.
That's really blocked,
Not
isn't
that
it?
one, yeah.
Have you broken your nose before?
No. Not that I know of.
It's quite inflamed and a bit angry on that side.
Right. In the past, when I've had it similar, I put my head over that albus oil in water.
That would help, definitely, what you just described. The other thing is a nasal spray, so I'll give you a prescription for that, and that should open it up.
Right, right.
Well, I'll go and do the prescription. I'll take Gemma with me, and I'll go and sign it, and she can bring it back for you.
Okay.
Is that okay?
Yeah, thank you.
We'll see you in a second.
Yep.
That's fine. That's good. Yeah. I think hit the nail on the head there. A physician's associate is something that's been used in many different healthcare systems throughout the world to really good effect. They primarily support the clinical team, and that might involve seeing acutely ill patients on that day under the supervision of a doctor, helping triage or work out who needs to be seen most urgently, and also helping us manage some of our complex and chronically ill patients alongside the doctor. This is likely to become more normal in the future.
Right, here we go. Sorry for keeping you so long.
Okay, that's all right.
So this is the nasal spray. It probably will take about a week or so to start feeling the effects.
Okay.
And if after a few weeks you're still exactly the same, no better, do come back.
Right.
Is that all right then, sir?
Yes, love. Yes,
Thank you very much for speaking with me. Sorry we've taken so long
No,
today.
that's right. Thank you.
Take care.
Bye. Bye. Love.
Number 17. You're both together, aren't you? Yeah. Can I just take a brief indication as to what the problems are today?
Mine is for a repeat prescription, and also I'd like to see the doctor about the pain I'm suffering, because I'm like it's a constant 24/7 pain.
And mine's for sick now.
So I can get you both seen together if you can either sit and wait until 10:20 or come back for that time.
Yeah, we'll come back at 10:20. Can you wait on her?
I will. Yeah.
We'll leave across the road 5 minutes. That sounds good. Similar like a sit and wait.
Yeah, we did used to do sit and wait many years ago, but we decided to change because it was just too busy and not everybody was getting seen.
Well, where we used to live, they still do the sit and wait.
Yeah, you see, we're a very big practice, you see. We've got over 23,000 patients, so if we did that, you can imagine how busy it would get. Lovely. So that's both your appointments this morning. You'll both be seen together, OK? Yeah. Okay. All right, no problem, thank you.
Here we are.
Hi, come on in.
Sorry, they kept me up there.
Oh, I know, that's why We know there's a bit of a queue sometimes in the morning. So, it was this thing here, wasn't it? Would you mind if I just refresh myself? OK. Right. OK. So we've done thank you for that. We've done a biopsy.
Yeah.
It's come back as a little bit thicker than we would have, than I initially thought.
Yes.
So the plan today is to remove that completely.
OK.
Just show you. From what we can see, if it's that sort of area, the current guidance is we're to measure 4 millimetres in all directions, and then we remove all of that, so a cuff of healthy skin.
Yes.
OK?
Yes.
Right. Right, I'm going to draw on you now, OK, just so we can get the boundaries.
I have to say, it's better than going to the dentist, this.
Yeah, I agree. Right, OK, grand. Right, here we go.
Little sharp.
3, 2, 1. Skin cancers can appear in various different forms, and often in their very early stages can be hard to spot. Sometimes they can be just a small pink mark that doesn't settle or a scab that doesn't heal. In Barbara's case, she didn't have a scabbed area or a non-healing area, but it was clear to me once I'd looked at it down the dermatoscope that it was cancerous and needed to be removed. If a patient is concerned, then they must go and seek medical advice and get checked over.
You're doing really well.
So at the moment, I'm just doing the deep layer. Would you like one of my tomatoes? Do you like tomatoes?
Yeah, I do.
They're really nice. I think they're really nice. Have a couple.
Small, isn't it?
Yeah.
So how do you practice doing stitches?
On an orange. On an orange, you make a cut in an orange and then stitch it back together. Yeah, that's what I used to do.
So when I first saw those 3 little red, almost like pinpricks, how long would I have had this growing?
Well, it's a spectrum, really. It sort of starts off at some sun damage where the skin just doesn't heal particularly well. You get these little marks, and then you start to get little red or white marks, and then those can sometimes change into these things. Right, 5. What do you think, Karen? We're all right there, aren't we?
Well, I need the mirror now, you know, like you do at the dentist.
We haven't got a mirror, have we?
I'll see it when I take the dressing off.
Yeah, I'll just leave it like that.
Thank you for that.
No, you're most welcome. Any other questions?
No. I think
Right,
that's fine.
I'll leave you in peace to get yourself sorted.
Thank you.
You're most welcome.
Come and have a seat. I'm Becky, one of the nurse practitioners.
Hiya.
Hi, I think we've met before, haven't
Yeah.
we? Yeah. Hello there. What are we doing today?
It only happened yesterday. She was a bit chesty.
Yeah.
And then last night I was watching her breathing. She was struggling, you know, like breathing really badly.
Okay. And she went in hospital, didn't she, last
Yeah.
year, did she, when she had bronchiolitis then?
Yeah.
Can.
She's got a high temperature, I'll give her calpol at 7:30.
Okay.
Are you clapping?
Are you clapping? Hey? And has she been coughing, runny nose
She's
or
had
anything?
a cold for about 2 weeks.
Okay. Right, sweetheart. Do you want to start getting her undressed and have a little look at you? Right, we'll listen to your heart, aren't we? Hey? I'm gonna pop that there.
No, it's...
What's that cough been like?
Barking.
More like a bit of croupy cough, really. So we're going to give her these tablets now, and then we're going to repeat it in 12 hours.
Right.
So do what you're doing. Paracetamol, ibuprofen, lots of fluids, wet nappies and things, OK?
Yeah. Right, that's fine.
Yeah. But we'll see what she's like this afternoon, and then we might just have to see her again tomorrow as well. Just
Yeah,
to make
that's
sure.
fine. That's
Is that
totally
all
fine,
right?
yeah.
Okay, I'll get door for you. All right, sweetheart.
Thank you ever so much.
See you later on.
See ya.
Bye-bye now.
Sylvia, please. Hiya, Sylvia.
Hi.
Come through. Come in, Sylvia. Please take a seat.
I'll have to take my coat off. I'm absolutely cooking.
My name's Dr. Eunice. I'm one of the GPs working here.
Yes.
How can I help?
But I cough and cough and cough. And then the sneezes come. It's uncontrollable. I can't stop it.
There's lots of different causes for cough. One of them is an infection.
Yeah.
Can we have a look? I think
Yeah,
that'd be
of
the
course
best
you
thing.
can.
So let's check your temperature first whilst you're seated. We'll check your temperature and your oxygen level. And then what we'll do is we'll have a listen to your chest.
Please.
You've got beautiful earrings on. Or studs. 36.8 temperature, that's fine. This tells us how well you're breathing. So your oxygen level at the moment, 98%, which is very good. And your pulse is 67, which is perfect as well. So what we'll do is we'll pop you on there. We'll pop the curtains round. We want to have a listen to your back and I want to have a listen to your front. And if you just take a deep breath in and out through your mouth for me, honey. Gonna tap on your chest. That's okay. Can I have a listen to your front as well?
You can.
Do you want to pop up behind the curtain for me, honey?
I'm just kind of coping because I lost my husband in end of May.
This year?
Yes.
Oh.
And he'd been in hospital before, you bring them out. And this time he went in and he didn't come out. So it was
Must have been a
bit
shock.
traumatic. Yeah, it is a shock. He had internal bleeding and obviously heart failure at the end, of course.
It's horrible losing a loved one, isn't
is,
it?
yes.
And I think nothing can sort of replace that bond.
No.
How about you in terms of friends and stuff? Are you getting out?
Well, I do some voluntary work. I've done it for up to our 12th year.
Mm-hmm.
There's a church thing that has babies and mothers and carers come.
Good
they come for
like
an hour.
a huge community, isn't it?
Yes,
Yeah.
I worked as a nursery nurse all my life with
okay.
children, small children. So I've been very fortunate.
In terms of your chest, when people are coughing and coughing for a long time, I want to make sure that we've had a recent chest X-ray just to make sure that
No, I haven't
that all
had one for a
sounds
while,
okay.
yes.
So I think let's get a chest X-ray
Yeah.
done. Listening to your chest, I can't hear signs of infection. No. And your oxygen level was 98%. You know,
good,
all of
isn't
that
it?
is very good.
Yes.
Yeah. But obviously,
Good.
if you do start bringing up the phlegm that you can see, or
Yeah.
things are getting worse, we want to see you again. But right now, touch wood,
That's lovely.
you're fine.
Oh, that's lovely.
And I hope it continues that way.
Yes.
Is that okay?
Oh, that's brilliant.
It's lovely meeting you. I'll pop this on. Do you need any help?
No, I'm fine, love. It's just I'm careful with this shoulder. It's a pleasure to meet you.
It's a pleasure to meet you.
Yes, and I'm very reassured with that.
You are a delight, Sylvia, honestly. Pleasure to see you. I'll leave an X-ray form out in reception for you.
Yes.
Out that way
Yes.
and down.
Thank you, dear.
She is lovely.
Take care.
Bye.
Thanks. Bye-bye.
Thank you very much for your help.
Cheers.
Take
You
care.
Take care.
Bye.
Thanks. All the best.
Thank you.
All right, see you later. Bye-bye. All right then, thanks
All
a lot.
right, take
Bye.
care now. Bye-bye.
Good morning, the Ridge Medical Practice. Vicky speaking.
Now I'm going to go into full lecture mode.
Please don't give me a lecture, because I know all about it.
She keeps coming out in like these little spots, but she's having black poos.
The I pass urine, it smells horrible.
How long have you had the smell of urine for?
Oh, too long.
And I found that I was having some menopausal rages, particularly with drivers.
I'm really proud to work at the Ridge.
Yeah, I am.
I feel that working in the Ridge is a bit like a big family.
It feels that way, and literally, loads of us are married to each other.
One of the things that I really like about my job is how varied it is.
No 2 days are ever the same.
You never know what's going to hit you.
We have all sorts of characters coming through the door with different stories to tell.
There's all different cultures and all different languages.
We have to be ready for all sorts.
We can get anything from a cough and a cold to a cardiac arrest, and it just seems to be all in a day's work.
The next thing you know, it's 6:10, and you think, gosh, where did today go?
Come in. Come
Hello.
in. Oh, sorry, I've no.
Hello, Doctor.
How are you doing?
Well, Professor, isn't it?
Oh, God. Yeah, come
I'm on it, right.
How are you doing?
All right.
You
I'm
enjoying
okay,
the weather?
actually. Bit warm.
It's warm, isn't it?
Why I've come to see you is this only takes 60 units.
Yeah, and you're on more.
Well, yeah, I managed to cut down, but I don't know how long it'll last.
Okay.
So if I have to go over 60,
Yeah.
it means 2 injections.
Yes.
Have you got another?
Let me see. I don't think it does. This particular insulin only comes in this pen. You can get cartridges,
Yeah.
but they would only fit the same kind of pen.
With the same amount
Yeah.
in? What about changing my insulin?
Well, the problem... It's up to you. OK, so your diabetes at the moment is quite well controlled, and it
Yeah.
has been for some time.
Yeah, it is. It's not bad, yeah.
We can try and find an insulin that's similar to this, but a lot of the pens for a lot of the insulins are exactly the same
Still on
as this.
60.
Yeah.
But I'm managing my diet a little bit.
Good. Because that was the other thing we talked about last time, is that
I mean,
sometimes
if
you had a bit of cake and ice cream and...
I know, I've cut them out. Apart from pudding she brings in now and again. Shouldn't do, but there it is. But...
Right, you can blame me.
Come in.
Hello, are you OK?
It's a cracking knock you've got, Stephen.
I know well. Don't want to mess around, do we?
So, Dr. Harris, hi. How can I help you?
I've got like some lumps on the back of my neck, which initially I thought was like an ingrowing hair because I shaved my head.
Yeah, yeah.
But it didn't manifest itself like that. And then I've come back from holiday, and it started to go red. Now I went to the chemist to see if they could get some cream, and he looked at it and said he thought it might be infected and to come to the
Some antibiotics,
come and see the doctor. I have been using like an antibiotic cream. That I got in Turkey.
So how long did you have the spots before you got
I've had them probably 2 months.
Right, OK. So
and
let's
it's
have a
not,
look.
yeah, to be coat off, you see a little bit.
Yeah. And you've not been bitten or anything like that?
No, I don't think, well, I don't think so. It's more hard. The spot's more of a solid spot and nothing comes out of it.
It's certainly fit with a folliculitis, which is an infection in the hair follicle, which you get probably because you shave your hair.
Yeah.
So you have a tendency to get that. But then this has clearly got more infected on top. So you need some antibiotics. And you need a good course of penicillin. You're not allergic?
No, not to my knowledge.
So if you take that, that will settle it down quite well.
But what's going to happen to the... Do I just have to live with the spot thing?
Well, they'll calm right down with the antibiotics.
Yeah.
And then you really just need to just be careful with the shaving. And sometimes just some antiseptic that you can use in that area.
Right.
But it is a tricky area to... Because what you're doing is you're blocking the hair follicle because you're shaving off their hair.
Yeah.
And then it just gets a bit infected. So if you keep antiseptic on, usually works. Sometimes medicated talc helps. And that dries it up, but it's also... will treat it as well.
Right.
So try those couple of options. But it's flucloxacillin you need.
And maybe let my hair grow.
If you want to, yeah.
I don't think so.
Hey?
I end up looking like Coco the Clown.
You've got to grow a ponytail. That's my advice.
Yeah, well. Right, thank you.
Let's wait for this.
Oh, God, yeah, I forgot.
Don't jump ahead of the printer.
Yeah.
So take the whole course, 10 days.
Yep.
And it'll all settle down quite
marvellous.
nicely.
Thank you very much for your help.
Cheers, thanks. All the best.
Have you had any thoughts about losing weight or how?
Yes,
how
I have.
What are your thoughts?
I've been to Weight Watchers. I lost nearly 3 stone.
Okay, when was that?
A while back.
Right, right. But a healthy diet would help reduce your need for the insulin.
I need to lose some weight.
Yeah. Now I'm going to go into full lecture mode, so just bear with me 1 second.
I know what you're saying.
Yeah.
Please don't give me a lecture.
No.
Because I know all about it. Been to
Yeah.
Weight Watchers, Slimming World, I know all about it.
But we have programs that you don't have to pay for that we can refer you to.
I know what to do.
Yeah. But there's free exercise programs that we can say you don't have to pay.
And now do I get the breath to do with those then?
Well, you build up slowly until your breathing gets better.
No, that's all I wanted to know.
Okay,
Yeah.
okay.
I'll have to lose some weight, yeah.
Tell me what you're thinking when I'm talking like this.
I'm thinking I know what I've got to do, and I don't want to do it.
Yeah, yeah, fair enough.
I mean, you can send me in all the courses you like. I know what I've got to cut out, how much I've even got the scales there to weigh my food, my potatoes.
Okay.
So I know what to do, so there's no point, is there?
And do you mind me asking you what's stopping you from doing it?
No, I've got a sweet tooth. I enjoy my food.
Yeah, yeah. It's hard. It's hard. I
know
find
it's
it hard
hard,
as well.
yeah.
Okay. As always, we don't need to do very much with your insulin because you seem to manage that very well yourself.
Yeah.
Your liver and your kidneys are working well. Your
Good.
cholesterol is good, 3.5. Your
it's not
urine
bad.
test is good as well. So I'm pleased with everything else.
Yeah.
So we just need to work
It's just
on
a
that.
matter of...
Willpower.
It is, that's what it
Willpower,
boils
isn't
down
it?
to.
Yeah.
You know, can hear the ice cream bell and I think, ooh.
Yeah. I understand. I have to have the same conversation with
The thing is,
myself.
I've stopped getting in now.
Okay,
You
that's
know,
brilliant.
Takeaways finished, ice cream finished, puddings finished.
What puddings do you make?
I just make homemade ones.
Like what?
You know, like apple and rhubarb crumble and...
Custard and cream and...
God, that is tempting. It'll be gone next time.
Next time you see me, I shall be...
Dancing in,
9
slim and
stone.
trim. Right.
Okay.
Lovely to see you.
Yeah, nice to see you as well.
Right, thanks very much.
Thanks a lot,
Nice to
Doctor.
see you.
Right, and nice to
Cheers.
see you
Take
as well.
care.
Thanks
Bye-bye,
a lot.
bye-bye.
Bye then. Bye.
Hello, how can I help?
She's been having quite a lot of reactions, quite nasty allergic reactions to something, but don't know what. And she keeps coming out in like these little spots all over her face or everywhere, but she's having black poos.
Okay.
And it's...
Have you brought some?
I have, yeah.
Okay, that's all right. We'll have a look at that as well.
She's
That's very
literally...
helpful.
She had an allergic reaction to a nappy yesterday, and just before she had those poos,
Yeah.
literally from head to toe, she comes out in them. It's like that.
And has she been poorly or
No,
anything?
no,
Has
she's been fine.
She's
She
been
had
fine,
sickness
yeah.
bug, but she's had these for quite a few months.
And she's not had any temperature. She's her normal self.
Yeah.
Feeding fine.
Yeah.
Passing urine okay as well and
Yeah,
everything.
yeah.
Okay.
She's been a bit cryy,
Crying.
but her belly does tend to swell.
And that's when she.
Yeah, she gets quite irritable about it.
Right, shall I have a look? I'm just going to check her temperature. Oh, I'll put it back. Oh, bless. Shall we just have a look at the nappy first? Yeah? Okay. Right.
Hey, Baba. Hey.
It does look really black, doesn't it?
What are you crying for? What's up?
My main concern at the minute is her, you know, this poo that is quite black.
Yeah.
Okay? Right. Oh, I'm so sorry. Can I just quickly check your temperature? Oh, bless. Just gonna...
Baby girl.
She's normally a happy child or...
Yeah.
She's just not been feeling well, is she? Oh, bless. Can we have a feel of your tummy? Yeah? Just a bit quickly. Yeah, we'll do that over there. We'll do that when she's... Yeah, okay?
I'm with you.
I'm sorry. I'm sorry. And can I see her nappy area as well? Let's get some looks. Right, that's fine. You can dress her back up. Right, like I said, from her skin point of view, the amount of reactions that she is getting, they do sound like allergic kind of rash.
Yeah.
So that's something that definitely needs looking at, okay? I think I'm going to speak to one of the pediatric colleagues at hospital,
Right.
okay? I've just run it by them and see
Right.
what they say. Are you okay to wait in the reception area?
Yeah,
Let me give them
yeah.
a quick phone call and we'll get you back.
That's
then,
fine,
okay?
thank
Thank
you.
you. Hi, my name is Dr. Hassan. I'm one of the GPs ringing from Ridge Medical Practice. Just ringing to refer a child to you, please, because she's noticed some black-coloured stools last night. But I'm just a bit concerned, you know, where's this?
What I can tell you about working here is that you will never be bored.
And often when I'm driving to work in the morning, I'm thinking, I wonder who I'm going to meet today.
How come you two got the same top?
Oh, because it's the uniform.
Is that being on? I love having regular patients. It's like seeing your friends.
Say ciao.
Ciao. Ciao, ciao.
Look who I've got, Debbie.
Are you okay?
Ridge patients definitely put a smile on my face.
You're a fancy little doctor, aren't you?
Well, I think we're two of a kind.
And so many of them had this really great sense of Yorkshire humour.
Come and kick you then, can I?
I'd rather you didn't kick me, really.
He's my best friend, anyway.
Dr. Harris.
No, Jesus.
No, all right.
I've been here now for nearly 9 years, so I've seen babies grow up, I've seen families expand.
You start to build up a relationship not only with individual patients, but you get to know whole families.
He's a really classic boy.
She shoots webs.
Shoots webs?
Yeah.
What do you like the best about school?
Dinner.
That's my favourite time as well.
They make me chuckle, and I hope I make them chuckle.
Is your bikini away for another year now, then?
Bikini, where to take you to? Where you
He's a happy boy.
Sometimes it's just the simplest thing. Patients just saying thank you, that makes all the difference.
I would like to award you a sticker.
Oh, thank you. That effect can last for days or even weeks sometimes.
You've changed my life.
Oh.
No, you have. Dr. Khan, you've changed my life.
Oh, I'll take that.
It gives you a real feeling of self-worth. It's one of the many reasons why I love doing what I do, and I love my job.
Hopefully, when they go out the door, they've got a smile on their face and they feel a little bit brighter and happier.
I've got good doctors.
Coming to see you.
That way, Fisk.
Hiya, come on in. Dr. Harris. Hi. Have we met before? I think we probably have at some
We may have done it, so
Yeah,
yes,
we'll have
yes.
done.
A long time ago,
Yeah.
probably.
Come and have a sit down here.
Right.
How can I help you today?
Yes.
So I'm Dr. Harris, and this is Navdeep, who's with me.
Yes, it's this was
Doctor observing.
right at the back of my leg.
Whereabouts? If you just stand up and turn round, and we might
Yes,
get a
good
better
to
look,
see
might
it,
we?
see it
Yeah?
better, yes.
Yeah, it's like a keratin horn, isn't it? So we could just shave that off and get that removed and then burn the base of that. That'll be fine, yeah?
Yes.
All right?
Right,
Good.
yes.
So let's get you comfortable.
Yeah.
So what would you normally be doing today then?
Not much. Well, it's a nice day. I'd probably just go for a walk.
Yeah? And where would you go for a walk?
Probably walk down. I live up Buttershaw, so I'd walk down into Wibsey Park and watch them play bowls for a while.
Oh, yeah.
Yeah.
Don't you fancy playing bowls yourself?
No, I used to.
Did you?
Yeah, yeah.
How competitive does that bowls get?
Oh, very.
I think it does as well,
yes,
yeah.
Yes,
All these old people, you can just tell they're getting really, they're getting really nasty with each other.
Definitely.
So, are you okay for local anaesthetic injection?
Yes.
This is the painful bit, it'll sting.
It does sting, will it?
Okay, just bear with it. Little scratch, well done.
Ooh.
Great.
Yeah.
How does that feel?
That's okay.
Feels okay.
Yeah.
You still okay there?
Yes, I'm fine.
If you need a breather at all, just tell me, won't you? Looks as though we've got the route as
I
well.
got a taxi down this morning.
Oh, did you?
Yes, yeah.
We'll just put your dressing on and then we'll review it in about 10 days just to make sure it's healing okay.
Yes, that's fine.
But I expect there'll be no trouble at all. I'm going to lower you down now.
Okay. Shall I leave the dressing on?
Well, keep it dry for a couple of days.
Yes.
The thing I just don't want you to do is catch it while it heals.
Yes.
I'll send you a letter about what we found on under the microscope.
Right.
So it's all action, isn't it?
It is, isn't it?
Yeah? Right, all the best.
Oh, lovely.
OK, take
Lovely.
care then.
Thank you very much.
Thanks.
Thank
Bye-bye,
you.
love.
Bye.
What, Bab? Come on, princess.
Come in. Hello.
Hiya.
Hi. right, Mum. So, spoken to the pediatric doctor in hospital.
Right.
Okay. They will see her now.
Right.
Okay.
Do you know what
So
it could be?
it's difficult for me to say. Okay.
Right.
So it could just be nothing. Okay.
Yeah.
It could just be because obviously whatever we eat also gives color to her, poo as well.
Yeah.
Okay. And considering how well she is, I'm not worried that it's something sinister or anything like that.
Right.
But still, it is concerning enough for me to have them have a look and make sure everything is okay. Is that all right?
Right, that's
yeah?
fine.
Okay?
Yeah, that's fine.
There you go.
Thank you very much. Thank
Take care.
You too. Oh, thank you.
All right, thank you, bye.
Cheers. See ya. Come in.
Hello.
There we
Hello. Take a seat over there. Now then, what's your name? Libby. Hello, Libby. Who's this fella? Daddy. Your daddy? Hi, Daddy. Well, my name's Debbie. So you're Libby May. What a lovely name. Now, what's the problem?
Well, she used to have eczema in her arms and everything, but then I managed to sort it out. The creams and everything that I used weren't working, but Vaseline started to work and it used to get rid of it. But then she came out with chicken pox and loads of chicken pox.
Yes, last month she had it.
Yeah.
Oh,
but
darling.
she's been scratching.
Yeah.
And it's got really bad everywhere now.
Oh, Libby.
Last night, she keeps picking at it as well.
Yeah.
So, but last night, she'd scratched it that bad, it were all, like watery.
Let's have a look at this one as well.
It's all down her arms and everything and on her hands now.
Oh,
Look.
sweetheart. Can you take your top off and let Debbie have a look at you? Ooh. Oh, are you good? Was it a bit stiff on your head? Has it got buttons?
I don't know.
Me and your dad are as bad as each other where dresses are concerned, aren't we? Darling. Here, leave it round your neck. Right, come here, let me look at you. Oh, you're sore, aren't you? Take your temperature, this goes in your ear. It's not uncommon when they've had chicken pox for their eczema to really flare up. We'll have to get you back on all your creams and that, won't we?
See, they didn't really help. She's even been on the steroids and everything.
Come here, I want to listen to your chest as well, because you're coughing, aren't you? You got a bad cough?
Yeah, she has. Really bad.
You're still smiling though, aren't you? Turn round, my love. That's a nice ponytail. Right. Don't tell your mum that me and your dad don't know how you do your dress, will you? Your dad might get in a bother.
She wouldn't see her mum. I've got custody of them.
Have you?
Yeah.
Just her, or has she got some other children?
2 girls.
And how are you doing?
All right.
And how old's your other one?
7.
And do you get any help? Does anybody help you?
I've got another girlfriend.
Right. She's lovely, isn't she? Have you got any sore legs, Libby?
No, not about her legs.
Right.
Can you do it? I drink, Daddy.
So she's got a flare-up of her eczema, which she knew about. Yeah. Don't worry about it because we can get on top of it. She's also got a temperature and she's got a few little crackles in her chest. It's possibly a virus because she's got a really snotty nose and everything.
Constantly.
She's constantly runny nose.
Never can get rid of it.
I'm going to give her some antibiotics because her skin needs some antibiotics where it's really red and sore. But I'll give her an antibiotic that if there were any chest infection, it'd treat that as well. Okay. I'll give you all the creams. We'll go right back to the beginning and then we'll see how she goes. Is that all right?
Yeah, that's fine.
Do you like coming to doctors? Do you like it? So I've put the moisturiser back on repeat. And so every single month you can get that, right? So never wash her in soap. Stand her up or shower her and get it on your hand and just make it like a soap and use that to wash her.
All right.
So we use that hand.
I've never been told that before.
Come to the right woman today. And 4 times a day, moisturiser all over. Everywhere where she's sore, this is a steroid cream. And it's a moderate steroid, not for her face at all, but all them sore parts here, put that on twice a day.
Okay.
Okay? And then that's some antibiotics, which I think she needs as well. I think her skin should get a lot better. She should be fine by next week.
Okay.
And are you going to put your cream on? You're going to help your daddy? All right, then.
Come
What
on in.
beautiful manners. Bye-bye. Okay. See you later, darling. Thank you very much. You're doing a lovely job.
Thank you.
See you later.
Over the last year, I lost my dad, my nan, my uncle, my best friend.
Oh, goodness, that's tough.
I think as a GP, we go through a lot with our patients. We have a lot of deep and meaningful chats with our patients.
My wife passed away 2 months since,
Oh, I'm sorry.
after 70 years.
Oh, you must miss her.
I do.
So I mean that's a lot of stress, isn't it?
Yeah, and I don't talk about it.
Yeah, yeah.
I particularly remember having to break bad news to a lady who was only young, with children who had cancer everywhere.
He'd been in hospital before, you bring them out. And this time, he went in and he didn't come out.
She died a couple of years ago now. But...
It can be quite an emotional roller coaster at times.
When that's happened, it can put it's a dampener on your day. You know, you need your spirits lifting a little bit, because it is sad, but unfortunately, it happens.
She'll always be a challenge, that lady.
Good morning. Have a seat. I'm Becky, one at Nurse Practitioners.
Hi.
Hiya, how can I help today?
The thing is, I've been having problems eating till I get a breakfast in town. It goes right through my system. It gives me diarrhea every time.
OK.
And I've been out for the last couple of weeks.
OK, so have you had diarrhea every day for 2 weeks then?
Yeah. Till I pass urine, it smells horrible.
OK, so you've got smelly urine as well?
Yeah, I've had it for a long time.
How long have you had the smelly urine for?
Too long.
For a long time?
Yeah.
And how many times a day are you having the diarrhea?
It's every time I go for something to eat, like a breakfast in town. So I have a breakfast every morning, see, in the cafe.
And what do you have in the cafe? Is it like a fried breakfast or...?
Egg, bacon, sausage, tomato and beans.
And you've eaten in the cafe for a long time, have you?
Yeah, I always have a breakfast in the morning.
And have you been travelling anywhere or done anything different?
No,
or?
not really, no.
Okay.
I went down to my mum's 2 weeks ago to arrange for a funeral.
Oh, dear.
I lost my brother.
Oh. So you've had a rough time of it, haven't you?
I lost 2 husbands. One uncle, 2 cousins, and my dad. It's gone all wrong.
Yeah.
It's gone all wrong.
Yeah.
I don't think it's possible to work in primary care, really, in a GP surgery without that sense of team spirit.
Do you have anything that needs doing, taking out?
I could probably do some exercise. Do you want to just run me around a bit?
Oh, I don't do that myself. You'll get your reward in heaven.
I'm going to heaven anyway.
Yeah, I'm not.
People who start as colleagues often end up as really good friends.
Would you like one of my tomatoes?
Are they
Do you like
homegrown?
tomatoes?
Yeah, I do.
Yeah.
I do.
Have a couple.
Small is beautiful. Who's making your wedding cake, Amir? Me.
Have you ever made a wedding cake before?
No, but I can try.
We do all get together outside of work from time to time.
Are you coming to our night out then?
I probably will come, yeah.
I go to the gym with Dr. Chris Harris every night of the week, pretty much.
Hi.
Cheers, mate. No, it's nice to see you.
The cheekiest person who works here is definitely Amir.
I think everybody's noticed that.
And his partners in crime tend to be Debbie.
Is he there?
Yeah.
Right, get out, get out, get out.
And Karen.
Karen?
They all have a good sense of humour.
Yeah, they do, and make our days go a lot quicker.
We have lots of fun, we work really hard, but we don't take ourselves too seriously.
And I think we go through a lot together and quite highly emotive times, and I think it's such a fantastic supportive team here, and that brings us all closer together.
So, how are you doing?
I'm all right.
Yeah. So, last time I saw you, you mentioned that you had a problem with your finger and it kept getting stuck.
Yeah, they're both getting stuck.
Does it hurt anywhere?
It does hurt.
Show me where.
Mostly all my fingers, there.
Yeah.
About there, look.
Okay.
And about there, look, that there. That hurts.
Can I have a look?
Yeah.
That's okay.
The big finger there. Trigger finger.
So just make a fist and then in again and then out. Okay.
It's about there.
Yeah, I can feel it.
You know, and I've got one there and all.
Do you know what trigger finger is? Do you know what happens?
know.
Okay, so in your hands, you've got these tendons that move your fingers up and down, and they move within a sheath, really. So it should be a nice, smooth movement like that.
Yeah,
but sometimes, sometimes the sheath gets tightened around the tendon,
and it's not easy for it to move back and forth.
And it locks then,
And it
doesn't
locks,
it?
yeah.
That's right, I know that part, yeah.
So what we're hoping to do today is pop a little injection into where the sheath is, where it's got tight, and put a bit of medicine in, some steroid, to try and reduce the inflammation and try and release it so it goes back to being a nice, smooth movement again. So if we can just move you across here a little bit, and if you just turn your hand around. I've got to say, you're the smartest man I've seen in a long time. You're so well dressed.
Oh, thank you. I'm too good for Leeds, and I'm too
good for Leeds? Right, you're just going to feel a sharp scratch now, OK?
Oh,
and it'll just be a bit sore.
I'm used to them.
Sorry, here we go.
I've had loads in the hospital. I've had needles in my head.
Needles in your head?
Yeah.
What was that for?
Oh, that's because they found some cancer under my eye. I still got a scar. Yeah. They got it all out. So I said, and then later, you've lost your eye. I've only had one eye.
Oh, bless you.
That's all done. It might not get better for a few days, but it should get better. This time next week, it should be feeling a lot better.
Yeah.
And I'll send you out another appointment to do the
Yeah.
other side, probably in about 2 or 3 weeks' time. Is that all right?
Yeah.
I'll say goodbye, but I'll see you
Goodbye.
again for the other side, OK?
I'll help you up, yeah?
Yeah. Oh,
Are you OK?
I'm all right. Yeah.
Right, well, there's your trolley. I'll help you with this
Oh,
outside,
you
OK?
I forgot to tell you, I was a role model a couple of weeks ago. I walked on the stage and I got into the final,
Uh-huh.
but I didn't win.
It should have been you. I'm sorry.
I know, it should have been me.
I know. It's not good, is it?
It should have been me. Like that song.
That's fine. Do you want to come behind the curtain? Can you give me a cough? Can you pull your tummy in and push it out? That feel OK?
Yeah.
Yeah? Thank you. Have a little feel. I'm really sorry, my hands are always cold.
That's right.
I suppose the only other thing that we could do this morning that we haven't done yet is have a little feel into your bottom. So if you lay onto your left-hand side, facing the wall, that's it, and then draw your knees up to your chest, and then you'll just feel some cold jelly on my gloved fingers. Is that all right?
That's fine.
OK, lovely. That's fine. Well done. So your tummy feels fine. You've no high temperature at the moment. OK, that's good. This could be a bit of a bug that you've got, although it's gone on, 2 weeks, hasn't it?
Yeah.
So I want to do a couple of poo samples, OK,
Yeah.
for you to do. And then I want you to get some bloods done this morning.
That's fine,
Is
yeah.
that all right?
Yeah.
Do you think you'd be able to go home and have a cup of tea? And we need to get plenty of fluids into you.
I will do, yeah.
Yeah, OK, and make sure that you're weeing regularly.
Yeah.
We'll send that urine off as well, OK? If your pain and everything gets worse, I need you to come back sooner. The blood results will be back by the beginning of next week, OK? And I'm just going to sort out for somebody to do your bloods now. All right,
OK,
so
yeah.
you can put them in your bag. So have a seat in the waiting room.
Yeah.
And you'll get called through shortly to have a blood test.
OK.
Is that all right?
Yeah, it's fine.
Yeah. You take care.
Yeah.
We've had a message from the health visitors to say that you've been concerned about his arm, actually.
Yeah.
So tell me what you've noticed about his arm.
Right, his left arm, it's always, at the back of him, and he's constantly got his fist clenched.
Right, and that's been ever since he's been born?
Yeah.
So tell me about his birth. Did you have a normal delivery?
He was born by emergency cesarean.
Right, and why was it an emergency? Did he just not progress?
It was planned to be delivered by cesarean anyway.
Right,
because I'm insulin-dependent diabetic.
Fine. So is he your first baby?
No, it's my third.
Third. And you're worried about his left arm?
His left arm, yeah. When I hold him, it's always, at the back of him.
Right. Let's strip him off and have a little look at him on the bed.
His nappy?
Yeah, that'd be good, because then I can listen to his chest and check his lungs and everything as well.
Let's strip you
Do you
down,
smile
darling.
nicely?
He does.
Do you smile at your mummy? Hey? Hey? Are you going to smile at me?
His muscles, she said, more like...
We've got a bit of...
Oh,
it's
you're
all right.
being sick, darling. We've got a baby here.
Here you go.
It's because he's just been fed.
Has he? Oh, dear.
feel loads of bibs, don't we, darling? He seems to have more muscle at his side than this one.
Can you turn him away from me again? We'll just see. Is he smiling at that? He's not cross.
No, he's not.
Moving his...
I mean, he does use it, but not quite as much as his right one.
I can't really see that there's any muscle wasting on that side. He's really active with that arm. But what you're concerned about is the positioning of it being behind his back. Has the health visitor actually witnessed it?
We tried putting him on his tummy and he just won't do it.
Should we try that? Let's try him on his tummy on here.
We don't use them, that, do we, baby? I can't use one, can we?
Why not?
His arm goes really, really stiff.
We're not so keen on tummy, are we? Oh, do we not like
No,
that?
we don't mind it, actually.
Do we not like that? Do you mean like that?
Yeah.
Oh, darling, pick him up now.
Just look.
Where, darling? So you didn't mention it at the 8-week check. Had you not noticed it at that point?
I hadn't really noticed it at that point, but when I was pregnant with him, on his scans, they did say that there was a possibility that he wasn't going to be born with one arm, because they couldn't see his arm on the scans. I mean, I didn't find out I was pregnant until I was 23 weeks. And I had my scan at 24 weeks, and that's when they noticed that I really going to have one arm.
That's interesting, isn't it? Maybe he was in the womb in a funny position with his arm. I think probably just leave it with me. I'm going to just check with one of my colleagues to see whether there's anything we need to do about this. It might be that we ask the paediatricians to have a look at him.
Yeah.
Leave it with me and I'll give you a ring in the next few days. Is that all right?
Yeah.
All right. OK. Bye-bye. See you, bye.
See ya.
One, two, three, it's good to be me.
Come in. Hello. Hi. Is it
Morning,
Kevin?
how are you? All right?
I'm good, thank you. Come in, have a seat.
Good. Morning, girls. You all right? Good.
Kevin, my name is Dr. Hassan. I've got a couple of students with me as well. Is that okay?
Yeah, that's fine.
Right, okay. What can I do for you today?
I keep collapsing.
All right, okay.
I think it's my cartilage what keeps tearing.
Okay.
I've been down to the physio for the last 3 weeks and it's not doing out. Last week, I was in that much pain, I couldn't go to work.
So all in all, it's been, how long has it been going on for?
3 or 4 months.
3 or 4 months. So you were fine before that?
I was just fine and just all of a sudden I can just walk down the road and I'll just collapse and just my knees will just give way.
What do you do?
I'm a chef at a hotel.
So how are you managing with your work?
I just have to hop around and hope for the best.
Are you taking anything for the pain at all?
All I've been doing is taking paracetamols.
Can I ask you to come over here?
Yep.
You're going to have to lower your trousers for me to have... Are you wearing boxers and things, yeah? Let me just... Are they okay to join in?
Yeah, that's what they're here for.
Yeah.
No good hiding behind the curtain if they're not going to learn out.
So if you just lay down for me, just relax back. Okay. So where about does it hurt? Does it hurt on the front or on the sides?
Sometimes it's this side and sometimes it's there.
Okay.
And I get a shooting pain.
That's painful.
Yeah. Whoa.
It's painful at the back as well?
Yeah, that is. Okay. So is that.
Oh, I'm sorry. I'm sorry.
One of the things I love about being a GP is that it's so unpredictable.
You never know what's going to come through your door.
I was asking a patient about whether or not he smoked. He said, oh, on a good day, love, I'd have 40, 50 cigarettes. And on a bad day, thinking, oh, it must be 100. And he went, oh, no, on a bad day, love, I'll only manage 20.
A man came in who had a really big sebaceous cyst or a big skin tag. It was rather large. He then decided he was going to keep this skin growth because he'd named it Paul and he wasn't quite ready to let go. He ran out of the clinic, basically, and we never saw him again.
I used to work overseas, and as part of that, I was learning the language. I thought I was asking the patient, is your poo slippy, runny? But what I'd actually said was, is your poo tasting sweet? And everybody fell around laughing.
I once had a consultation with a lady who came to ask me to amend a sick note because she wasn't happy with what the short, bald doctor had written on the sick note. And I let her ramble on, then I said to her, you do realise that short, bald doctor is my husband?
So
So I was once fertling around in some chap's groin looking for a hernia. And part of the examination is you ask the patient to cough. I normally say, give me a cough, but instead I said, give me a kiss. And his face was a picture.
There we are.
Hello, ladies.
Hello.
How are you doing? All right, Syra. Look at you, all big now. How are you doing, Sarah?
okay.
Come and sit down. How was your scan?
Scan was okay.
Yeah. Boy or girl?
Don't know yet.
Do you know? No.
My instincts are, this is going to be a boy.
I have a feeling you're having a boy as
Do you know
well.
what? Everything's totally different.
Yeah.
Everything is different.
Yeah.
Let me tell you on my birthday.
When was your birthday?
16th of September. Oh my God. I'm 9 now.
Congratulations.
What did you get?
I got makeup, I got nail polish, I got a
Makeup and nail polish.
Ooh.
Malika, can we have a little talk about things?
Yeah.
Is that okay? Your mummy went to see Dr. Knight, who's your heart specialist as well. Were you there?
Yeah.
Yeah, can you remember what he said?
No.
No. Should we just have a little talk about that?
Okay.
Is that all right? So sometimes when your heart is poorly, it means the lungs have to work harder to get all that oxygen going round your blood, which is why sometimes you go a little bit blue and your oxygen levels drop. And some people thought it was because you weren't getting enough air through your throat, and some people thought because your heart was poorly and it wasn't working. And we all now agree it's not because of up here, it's more because of your heart and the poorliness in your heart. We were hoping that when you get a bit older, they were going to do an operation on your heart, but because your heart has made your lungs poorly, we now have to wait a bit longer until your lungs get better, and then we can do that operation on your heart. So we might be waiting a few years before we can do it.
So we have to wait a few years until my lungs get better. They're going to do an operation on me, so my heart gets better, and I'm like everybody else.
Well, you already like everyone else.
I'm not.
You are. You're special.
I always in hospital with Mummy, and nobody else gets to spend time with Mummy. It's just not fair.
I know, but you get lots of other nice things as well, don't you? And we're all looking after you, as you know. How do you feel about that?
I don't know. That was so much.
It's a bit complicated, isn't it? Even for us, it's hard.
Yeah.
So for you, it must be really hard. But all you need to know is that we're hoping to get things better sooner, but we're just going to wait. So it doesn't mean you're going to be more poorly. It just means you're going to be waiting longer for that heart operation that we were all hoping for. So why don't I arrange to see you again in a couple of weeks after you just have some time to think about it?
Yeah, no, that's lovely. Thank you so much.
That's it. Shall I try and get you in before the end of this week?
Yeah, please.
I'll sort it out.
No, that's fine. Thank you
All
so
right.
much. Thank you.
Take care, darling.
Right, thank you
All
very
right,
much.
thanks. Bye-bye.
Bye.
Just press that button there on the left.
Oh, yeah, we've got...
And then you go out that way.
What is wrong with Malika's heart?
So she was born with everything the wrong way round,
Right.
which often isn't a problem, but she also had lots of narrowings in her major blood vessels and 2 big holes in her heart as well.
Wow.
So everything was going round the wrong way. So low oxygen levels, heart murmurs, going blue. And so she's waiting for this Fontaine procedure. They've written in the notes that they're going to keep an eye on her lungs and wait for her pressures to come down.
Yeah.
So,
It must be so hard.
I know.
Poor little love.
Come in. Any problems I need to know about?
I don't think so. I did have some fluoxetine a while back.
So stopped how long ago?
About 3 months.
And you're okay?
Well, I was taking it because I don't want to go on to HRT. And I found that I was having some menopausal rages, particularly with drivers. And it was impinging upon life. And it helped, it really did help. But then I thought, do you know what, I've got to get a grip. I've got to, you know, try and conquer these feelings.
Because they do tend to try that first now, don't they?
They do, yeah.
I tried it.
It was really surprising, you know, and gosh, it worked. It was great.
And it didn't do for me.
But I thought, well, you know, now I actually know what it is, I can deal with it a bit better. Instead of having the stress and the pressure and then thinking, I'm losing my mind. Yeah, it worked. So I thought, well, now's the time to try and wean myself off it. So I didn't stop straight away.
I think you can go somewhere like Menopause Matters.
Oh.
I tried it, I tried without it, I tried with it. It's
Did you?
so much better with it.
Is it so? Mm-mm.
I'm just going to move this knee for you. Just relax again. Does that hurt?
Yeah.
On the inside? Okay. Now just keep it there for me. Right. That's fine. Come back. Okay. Good stuff. I'm thinking, you know, after examining you, it's painful in literally every direction,
Yeah.
every movement, but you're not able to move it completely.
No.
I think we're gonna have to get you seen by one of the specialists who
Right.
deal with kind of knee problem. They're called MSK people.
Yeah.
Okay, so I'll send them the letter. I'll do a prescription for you for some gel.
Yeah.
Okay, you can rub it 3-4 times a day.
Right.
And that seems to work really well, especially for knee joints and for
Yeah.
hands. Okay.
Where I work, they
Yeah.
asked me if I could get a sick note for last week because I took all week off because I was in that bad of pain.
Right.
I end up crying with it. It's not like
Oh gosh.
me to have tears in my eyes.
Right. No problems. So that is your sick note.
Take that working tonight.
Okay. And let's take it from there. Okay.
Okay, thanks
Good
very much.
stuff.
Thank you. Hopefully
you.
get something done.
All right.
Right, thanks a lot. Yeah,
Bye.
Have a good day. Try not to work too hard, girls. See you later.
Mum, we'll do your weight. Okay, 83 is 13.1. So this is where you are. Okay, BMI 35. So any reduction is going to be good.
Well, on the plus side, I am going to the gym.
Very good.
Which is very recent. But on the poor side, really, it's just piled on. And I've gone bigger apple.
Yeah.
I'm kind of, you know, super-size apple now. So what can I do to get my cholesterol down then?
We reckon reducing saturated fat, so anything that's solid at room temperature, your butter, your lard, your cheese, things made with that, so pies and pastry. If you like cheese, I'd normally say go for a really strong cheddar and grate it. So you're getting the taste, but you're not getting as much. So we probably just need to see you every year around about your birthday. So just before your birthday, think it's MOT time. All right?
OK,
So this time next year, you're doing OK.
But I might be thinner then. I shall see you when I see you.
Okey-doke.
OK, I'll take this with me.
Yes, so we'll see you October.
October. Cheers.
See you later. Bye.
If I could describe working at the Ridge in one word, it would be...
Fulfilling.
Immense.
I want to say
Interesting. Working at the Ridge is like one big adventure. Lovely.
In a word, I think it'd be perfect.
can be frantic.
Stimulating.
Loud. It's always loud.
Busy. There's never a dull moment.
Life-changing, but that's two, sorry.
I could never describe working at the Ridge in one word, I don't think.
No, that's probably the best answer, yeah. Which medical practice have you speak in?
There's a direct quote. You said, "I feel alive again."
And I still do because I'm not drugged up to eyeballs.
It's hurt all the time, is he?
Has something like this happened before?
No.
Sharp scratch, sorry. Tell you what, Nathan, I've had bigger boys cry when I do this.
You don't like doctor, you don't like to wait.
It's easier to get into heaven than getting to see a doctor.
I've got to enjoy life.
Enjoy life and don't let this hold you back.
No.
Come in. Hello, is it Victor?
Yes, it
Hi,
is.
Victor. Come
Hello.
in. You're looking very smart.
Thank you.
Is that for my benefit?
Oh, yeah.
Go and sit down. Right, how can I help?
Well, yesterday I was going down to pick up my little brother from school, and when I was walking down, I started feeling a sharp pain, lower right side of my abdomen.
Okay.
So every time I put weight on my right leg, the pain started coming more and more.
Sure. Okay.
For the first time, I didn't go to football, which was...
Okay. So that's a big deal, is it?
It is, yeah.
Fair enough, yeah. And is the pain there now as well? Okay. And how would you describe the pain?
Kind of piercing towards, like, some of my bones, I'd say.
Yeah?
Yeah, just the top there, just at the front.
Any nausea, vomiting?
No.
No? Going to the toilet okay?
Going to the toilet a lot.
A lot,
Yeah.
okay. Should we have a feel of your tummy? Do you want to just come up on the couch for us?
Yeah.
Are you worried it might be anything in particular?
My mum said that it could be something with the appendix. I just thought it was a bladder.
Yeah.
So,
Well, it's around the same place as your appendix, so it's something we need to rule in or out, really. So just relax, head back, nice and relaxed. If you just point to where you're getting the pain.
It's right there.
Around there. I'm just going to start on this side. Is that sore?
Yeah, there.
About there. Okay, that is sore, isn't it? Okay. I'm just going to check your pulse. And if you had to describe the pain, kind of 1 to 10, where 10 is the worst pain you've ever had, what would you say?
It's probably like an 8, but...
8, okay. I'm just going to have a listen into your bowels as well. That all sounds fine. Do you think you'd be able to give me a water sample?
Water, yeah?
Yeah?
Come
Come on then.
Take a seat, my love. Who's this lovely lady? My mum. Right, what can I do for you today?
My throat is really sore and hurting.
She gets sore throats all the time. I just don't bring her every time because, you know...
I've had a look and see about a tonsil, you know, when we've seen her with it. Are you ready? Temperature first. Has she had a fever?
No, not that. No. She's only been like it since weekend.
Right.
She came home from Dad's at weekend and said, do you know, my throat's really hurting.
Are you good at opening your mouth really wide?
No.
Have you got a cough or anything?
I have it
On a night I've heard her coughing, yeah.
Open wide. Big R. This torch is brilliant.
Put your tongue down.
Bigger than that. Come on.
Do it.
Ah.
Open your mouth, Claw.
Good lass. Right, so looking at her temperature's fine. Her tonsils are very, very big tonsils, but there is no tonsillitis at the moment. Okay, so I've looked at her record and she had a nasty tonsillitis in July. She was poorly, wasn't she?
Yeah.
This, I don't think, is a bacterial infection. I think it's a viral infection. It goes with a runny nose and a bit of a cough. When you get to about 12, 13, your tonsils often start to shrivel down.
Right.
A lot of adults don't have any. We look in the throat and we don't see any tonsils, and they've never had the tonsils out. They just go.
Yeah.
So I think we can plod on at the moment. Plenty to drink. Paracetamol. You know, if she gets hot and poorly, or you'll know, because I know you're a sensible mum. She's sensible, isn't she, mum? Most of the time, So you know where we are if you need us. Keep plodding on. Get a bottle of water.
That's what I told you, just keep hydrated.
You young ones, teenagers, they don't drink, do they? No. You need to be drinking constantly. Drink now while you can. Me and your mother will be running to the toilet every 5 minutes when we drink a lot.
Definitely.
All right, my love.
All
Is
right,
that okay?
Yeah, thank
See
you very much.
later.
Thanks.
Bye-bye.
Bye-bye.
Any joy?
Yeah.
Perfect. Oh, plenty. Right, come and sit down. Seen in your records you're from Malawi, is that right?
Yes.
Yeah, how old were you when you moved?
I was 5.
Were you? I did some work in Malawi, actually, in Blantyre. I did some voluntary work in a hospital over there for 6 months.
Do you remember the name of the hospital?
I want to say Queen Victoria or something.
That's where I was born, I
Was
believe.
it?
Yeah.
Yeah?
I believe that's where I was born.
There you go. The urine is absolutely clear, but that rules out a urinary tract infection, but it doesn't rule out appendicitis. The only real way to find out is to send you into hospital for them to do some blood tests and a potential scan and keep an eye on you. I'm going to give the hospital a call. I'll tell you exactly where to go. It'll be the Bradford Royal Infirmary. Do you know where that is? Yeah. Okay. Hi, can I make a surgical admission, please?
Did you always want to be a GP?
No, not really. When I was younger, I wanted to be a vet. I don't really know what happened. I applied to do medicine instead. I think my mum was a deciding factor in that. And then I thought about doing paediatrics for a long time. In fact, when I was in Malawi, I was working in paediatrics, which I really enjoyed, but then I missed adults and conversations with adults and that kind of thing. And with general practice, you get the best of both worlds. You see children, you see adults, you see a bit of everything. Hi, thanks for taking my call. My name's Amir. I'm a GP calling from the Ridge Medical Practice. Hi, I was wondering whether you might be able to take a look at an 18-year-old chap for me who I think might have appendicitis. Started yesterday, gradually got worse, describes it as 7 out of 10 in severity. Otherwise fit and well, yeah, hardly ever comes in. Thank you so much for that, I appreciate it. Cheers, bye-bye. Yeah, they're happy to see you up there. I'll just give you this to take. I would go home, tell your mum, pack an overnight bag in case, and then go to Ward 20 at the hospital. There you go, Victor. Best of luck, mate.
Thank you.
All right, thanks for coming in. Cheers. Don't forget your jacket.
Yeah.
Nothing to eat or drink until you've seen them.
All right, that's fine.
All right, okay. Cheers. Take care, mate. Bye.
See you.
So what's happened today?
School's rang me up about 1:30 saying she's had an allergic reaction to something, but we don't know what.
Okay. She's allergic to nuts, isn't it?
We know she's allergic to nuts. Then they've given her erythrodine. They said she had problems with the breathing. She got wheezy.
Okay.
But she's quite blotchy around her face.
Itching as well. Do you remember what you've eaten? No.
What she has said is there was children having chocolates on the carpet.
Okay, so...
That's the only thing I can think about.
Let's have a look at you. When did you pick her up?
I've just picked her up about 15 minutes ago, but she is getting more blotchy.
Since then and now, do you think that this is a bit more different in what she has been, right?
Yeah.
Okay, let's have a listen to your chest. Can you stand up for me? Can you lift her top up, Mum?
Yeah.
Okay, have a seat. Her skin is red, her cheeks do look red. In case, like, you know, it became a full anaphylactic reaction, we're going to call the paramedics like a 999.
Anyone else waiting to make an appointment?
Peekaboo. Ready?
Ready?
Oh dear, that were a big sigh, weren't it? Can you say a big R for me?
Say ah.
Stick your tongue out. Thank you. Thank you.
Listen at your chest.
That's big.
That's because I've got a big head. Okay.
Is it ticklish?
Ticklish, aren't they?
Oh, hiding.
Where are you hiding?
Come on, are we going? This doctor's got more patients to see. Come on, I know you're special, but you're not that special.
You having a relax?
Bye, everybody.
Bye-bye. See you later.
Right, thank you.
Cheers.
Bye-bye.
Come in. Hiya there, come in.
Hiya, thank you.
Oh, is this little Louise?
Yeah.
Come in. I've got 2 students with me as well, if that's all right today.
Yeah, that's fine.
Thank you. How can we help?
Well, I came on Monday about downstairs because she's very sore and it's just got worse. It's spread around her bum.
Oh, poor love. Is she sore?
Yeah.
So this problem with the nappy rash has been going on for how long now?
About a week now.
Right. Could I have a look, do you think? Maybe if we take her coat off and just have a look. She's all right on your knee, though. I don't want to upset her. You're a good girl, aren't you? I like your shoes.
Very tired, aren't you?
Got a Minnie Mouse on your shoes. They're pretty.
Oh.
So she's in nappies?
Yeah.
Yeah.
I know.
Good girl, I'm going to stay over here. Oh, dear.
All right, darling.
Oh, bless her.
She's really sore, though. I don't know if you can...
Yeah, I can see. She is really sore, isn't she?
And it's like that at the front as well.
Yeah, let's just have a look at the front.
I'm going to put this mask on your face, OK?
Ready? There you are.
Is that OK?
Is that OK?
Yeah.
Yeah.
Pretend we're not looking at you. When was the last flare-up?
It's been a couple of months now. We don't know what's actually triggered it today.
So,
a trip to hospital in an ambulance.
Yeah.
Thank you very much for coming.
Thank you so much.
You're welcome. Good luck.
It's nice and steady.
Take this off you once we get outside, yeah?
Once we go outside, OK.
Okay.
Thank you. Thank you.
Okay. Hope everything gets.
Thank you very much.
Nice and slowly.
Cheers. Thank you.
Sometimes when mine have been really sore when they were little, I used to use like dipper-based cream on a cotton wool bud and just use that to wipe, moisturising cream, but to wipe and just clean, you know, and avoid water completely, because water can be an irritant as well sometimes. She didn't look 100% actually, but I suppose if she had a jab...
She's been throwing up all last night.
Yeah, should we check your temperature, little lady? Should we check Mummy's first? Let's put this in Mummy's ear. Are you ready? Wait for the beep. Are you ready? Beep. Look, Mummy's okay. Should we check?
Mummy's not got a temperature, do
Should we get Mummy to do it?
Mummy do it, look.
You just press the button down on the top.
Come here. Just let me get your ear.
Good girl. Good girl. Perfect, thank you. There, that's okay. Get that nappy off when you're at home. Fresh air's the best thing sometimes, just to help heal. Right, dipper base.
What's up, baby? We're going to go buy some puppy food.
Oh, have you got a puppy?
Yeah, we just got one yesterday, didn't we, for yours and your sister's birthday?
Got a doggy? You're mad. So how many? So what have you got them? A puppy? Oh, just one?
Yeah, just one. It's a star.
My husband wouldn't let me have another kid, so he settled on a dog, and I am sure another child would have been so much easier than a dog. So you're going to be running after Piddle from the little one with a nappy off, and you're going to be chasing the dog round. I can picture it now.
And then I've got a 2-year-old.
Running through it all. There you go. See how you get on, and if she's not getting any better, bring her back.
Come on then, shall we go then? Yeah. Gonna go get some din-din. Stop picking your nose. Well.
Take
See
care,
you later.
bye-bye.
Thank you. Come on then.
Hiya. Yeah?
You just love to keep women waiting, don't you?
Well, that's my wife. I stood her up on our first date.
Well, do you know, nothing surprises me with you.
Look at her now. She still loves me.
Is it... I was thinking your wife's the Dr. Amy?
Dr. Amy, yeah.
We met at Leeds University, didn't we, back in 1999, Freshers' Week.
Yep. Random pull in Majestic's nightclub.
And we got married in 4th year at medical school.
We've got 3 children, and we've worked together for about 8 or 9 years.
Do you know, I was shocked, actually. And I said to Neil, I went, I could have imagined him with, like, dolly birds.
She's a dolly bird, she's gorgeous.
But she's an intellectual dolly bird,
She's
isn't
gorgeous.
Quite a lot of the patients like the fact that they know us as a couple. I think it helps them to relate to us as individuals.
That definitely helps, yeah. And
we get lots of questions about how are the kids and the dog and...
Yeah. And you can share your own stories and people relate to you as a family and a couple, and I think you can...
Makes you feel more human rather than a doctor.
Absolutely.
Right then, down to business.
Yeah, I'm glad I've got to see you, really, because I saw you in January, didn't I? And we left it where I was going for the injection down my leg, which I had.
Did you?
Yes.
Yeah.
And it's been amazing. But things have deteriorated since I saw you. It started a couple of months after I'd seen you, because we were doing pretty well.
I'm just reading through what I'd written, and there's a direct quote. You said, I feel alive again.
And I still do, because I'm not drugged up to eyeballs, and I haven't gone back on the medication, no matter how.
So it was right
bad
to dig
it's been.
meals in one time.
Shall we give him that one, love?
Yeah, I'll take that one.
Right then, what's been going on?
What's happening is, I've got earache.
Yeah.
And I'm telling my teacher at school it's hurting, so what they've done is put a hot compress on me.
OK.
But it was still hurting.
What's he had for the pain so far?
Calpol.
Does that help a little bit? A little bit. And tell me about this. You've just been sick as well.
I was just thrown up everywhere out in waiting
Were you
room.
sick before this or not?
No.
This is just the first time. Okay. So your ear was just hurting at school. It was all right when you went to school this morning, was it?
Yeah.
Yeah. Right, let's check your temperature and then we'll have a good look, see what's going on. It's your left ear that hurts, is it?
Yeah.
Okay, well, let's pop this in this ear then.
Yeah, Jaden.
Anyone else been unwell in the family or just you?
Just me.
Just you. Okay. Right, let's have a look in your throat and then we'll look in your ears, okay? Just go, ah. Oh, well done. You're very good at that. Okay, so your throat's fine. It's not that. I'm going to look in your good ear first, the one that doesn't hurt, and then we'll look in the one that does, all right?
Okay.
What? No, you can't have no more. Look at it, Jaden's getting his ears done. Look at that! Yeah! Yeah!
Do you mind standing up for me to look in the other one? It'll just be a bit easier. Good lad. Oh, yeah. Oh. OK, have yourself a seat. He has got an ear infection, OK? The right ear looks completely fine, but the left ear's really red and looks really angry in there, OK?
Right, okay.
So the current guidelines are that you give really good, regular pain relief for the first couple of days.
Right.
Because it's causing him such a lot of pain, I can also give what's called a delayed prescription. So I give you a prescription today for some amoxicillin.
Right.
And if that pain relief that you're going to do isn't settling things down, or if he gets any discharge from that ear, then you start the antibiotics. Does that sound
Right,
okay?
yeah, that's perfect.
All right. We try to avoid antibiotics wherever possible because most infections are viruses anyway,
Right.
and then you don't want to take antibiotics for a viral infection because it won't do any help, and it can cause other problems as well as antibiotic resistance in the longer term.
That's absolutely fine. Have your sick ball down.
All right then. Okay.
Thank you.
All right then. Okay, you're welcome. Get well soon then.
Thank you.
Bye.
Bye. Come on, Jessie Jo. Thank you.
All right, bye.
It's not extreme agony where how it feels, the only way I can describe it is, you know when you've been kicked and you've got the worst bruising ever?
Yeah.
That is how it feels.
Right.
And even when I just bend slightly, I feel as if my skin's been stretched.
Yeah.
And it's awful.
We do see that. It's called allodynia, and it's where you almost feel pain from things that would not ordinarily give you pain, bed sheets rubbing over something, like loads of things that's nervous system related. We don't... you change your position.
Yeah.
Do you want to perch on here?
No, I'm all right. I'm going to stand.
There's often not an easy solution to it other than all the other ways that we try to manage your chronic pain. You still, even though you feel that things are worse since I last saw you, you're still a damn sight better than when I
because
first
I'm
met
not
you.
drugged up to eyeballs.
Yeah,
That's
yeah.
why, Doc.
Yeah.
You love that, don't you?
I do, yeah.
Some painkillers for long-term pain can actually be quite unhelpful. In short term, they're effective, but in long-term use, we find that, firstly, you can develop quite nasty side effects. Secondly, we find that the painkillers become less effective over time. And thirdly, and importantly, the longer you use some of these painkillers, they actually have an effect where they help you to feel pain more rather than take the pain away.
OK, so I think we know where we're at, and we've started some of the really important stuff, which is to reduce some of those drugs and make you feel human again. Would it be sensible to see me when you're at the point that I might have a go at some of the other drugs?
Just because you'll miss me, won't you, if I'm gone? So I am your shining star.
Well, there is a bit of that as well. Right, so when you're ready, come and see me.
Brilliant.
All right, anything else?
No, that's fine.
All right, good.
Thank you.
Bye.
See ya. Might as well go that way, haven't we?
So I feel like,
Hello. Are you a film star?
Am I a film star?
Of course she is, can't you tell?
Yes. She's so beautiful.
Oh, thank you. Oh, thank you. How can I help?
Right, what can I do for you today?
I've been coming to this surgery over 55 years. I went to the optician. They gave me eye drops because my eye was scratched. Now they have stopped the eye drop.
Who have?
The doctors have.
Is it one of the GPs or one of the doctors at the hospital?
The GP.
Oh, right, okay.
GP has stopped it.
Right.
Oh, if I was to buy them, it'd cost over £11.
I see.
I'm a pensioner, and I'm nearly 80 years of age. I'm lost for words. If I was to go blind, it'd cost a lot more.
Morning, my dear.
Hi.
You look good for 70 years old.
Are you a granddad or a...
11 grandkids.
You've got a lot of reasons to look after yourself.
You're only 65.
I know.
You're a young whippersnapper.
I've had 2 new knees, so I did a lot of walking.
And that's why you don't look 80, you look British, you look very good.
What's your date of birth?
2nd of the 2nd, 30. I wish I was as old as you.
I wish I was as old as them, to be fair.
You're not as young as I expected.
You look a lot younger than what your age says.
Forgotten is supposed to be retired.
Youth is wasted on the young, isn't it?
Thank you very much, Rosemary.
OK, see you in October.
Will do, love.
If I was to go blind, it'd cost a lot more.
Oh, we don't want you to go blind, do we? When was the last time you used them?
I use them every day.
Right.
I don't like coming to the doctors and wasting their doctor's time over
No.
drops.
If you need to come, you need to come, really.
I don't like coming. That's the thing.
And what's the reason for that? Is it you don't like doctors, that you don't like to wait?
It's easier to get into heaven than getting to see a doctor.
Now, Patrick, it seems like... You're smiling. Right, it seems like you went to see your optician, yes?
Yeah.
And when you were there, your eyes were tested by one of the ophthalmologists. So they were thinking that you might have what we call a glaucoma.
That's right. I
Yes.
remember. Yes.
Now you remember?
Yes, I do.
So it was basically those people who'd stopped it, that said you didn't need the particular ones that you were using at the time.
My eyes get irritated if I stop using them.
Yeah, yeah. But, Patrick, does it affect your ability to see? Does it affect your vision at all?
It does.
Do you think
if
it does?
I don't have the eye drops, yeah.
Right, OK.
I know there's cutbacks. I know that.
Right.
But I only take 3 tablets a day.
OK.
And
Now,
I'm over 55 years coming here.
Of course you are. But it's nothing to worry about. Now that you've come here, right? OK, and I see that you still need your drops, so I can restart you in those drops, can't I?
That's marvellous. Put it back on again, please.
Yes. So I'll put that back in your repeat prescription.
It's very good of you to see me.
It's all right. How's everything else?
Well, the last time I was here, I had blood pressure, which was high. And it's higher today.
Do you think so?
Definitely.
Can I have a quick check?
Yes.
Let's put that on. Let's put that here.
How am I?
Your blood pressure's absolutely fine.
Am I all right?
Yes, you're absolutely
That's
fine.
a miracle.
Hi, Nathan. Come in. Hi,
Hello.
Dr. Khan. Nice to see you. Hello,
Hiya,
Dr. Khan.
hiya,
Nice
hiya,
to
nice
see
to
you. Come
see
and
you.
sit down. Great. OK. And you came in just last week, wasn't it? And you saw Dr. Caris.
Yes.
And he said you got something called a pyogenic granuloma on your back. Tell me about it. How long have you had it for?
About 2 months now, and I didn't really notice when it started. Just in bed when it started bleeding.
Do you mind if I have a look at it?
Yeah.
Have you still got that dressing on?
Yeah.
We can take that off. Right, sorry. It's not very nice taking stickers off. Oh, yeah, OK, fair enough. It does certainly look like a pyogenic granuloma, yeah. Do you know what that means? Take a seat.
It's known for bleeding regularly.
Yeah.
It's traumatic skin into that cat over here or something.
That's right, yeah. So it's usually caused by a nick in the skin or something like that, and then it doesn't heal properly and it forms this over the top of it. It should come off quite nicely. Good. Yeah. Usually they're on a little stalk and we take them off right from the root. The only bit you will feel, Nathan, is me putting in the numbing medication, the anaesthetic, and that's a little needle underneath it. It'll sting a little bit as the medicine goes in. After that, you won't feel anything at all.
You're not bothered, are you? Just want it after.
You want it off? Fair play. Right, OK, so we probably need that shirt off. Is that all right with you? Yeah? Whitney, will you help Nathan just onto the bed? Are you OK to watch, Mum? You're a nurse, aren't you?
Yeah. I'm not a nurse, I'm a technician, but yeah, I'm all right. Yeah, I'm brave.
There you go. So just like to lie down on your front on here.
Be brave, Nath.
Are you nervous, Nathan? No, good lad.
Will you send it away then?
We send everything, yeah. Normally within 4 weeks you'll get a letter saying it's what we think it is. It's very occasionally it turns out to be something that we weren't expecting, but they tell us that pretty quickly. So, right, so I'm just going to give it a good clean, Nathan. It'll just feel a bit cold and wet. Do you like school then, Nathan?
It's all right.
It's all right. OK, so we're going to put a bit of the medicine in now. This is the worst bit. After this, nothing at all. Sharp scratch, sorry. Good lad. Didn't even flinch.
You okay?
Yeah.
Tell you what, Nathan, I've had bigger boys cry when I do this. So you're doing well.
Right, Patrick, how can I help?
Both my hands are slightly swollen.
Okay.
Both my ankles are swollen as well. Feet is swollen.
So tell me how it started. What happened?
It just came on one day. My knuckles were a bit sore and no bruising came up. But then it started swelling.
Okay.
And it's hurt all the time, you see.
Right. Okay.
And I'm thinking whether it's arthritis, because my runs in my family.
Okay. So something like this happened before?
No.
Never?
No, I suffer from gout.
Yeah.
But not on my knuckles like this, not for this long time.
And this time it's both hands as well?
Yeah.
Because gout tends to usually involve one joint.
That's it, yeah.
One side.
She wants her right puffy and I can't grip.
Yeah, okay.
You can't squeeze anything, you know.
Okay. Yeah, are both hands same or one's better than the other? Okay.
Same,
right.
yeah.
And you mentioned arthritis runs in your family. Do you know what sort of arthritis is it, or...?
Osteoarthritis.
Osteoarthritis.
Grandmother, she had all fingers all...
Okay. Let's have a look then.
Those two are the most sensitive ones.
These two, yeah. I can see a bit of swelling there as well, isn't it?
And in my knuckles as well, you know.
So...
That's sensitive there.
This one is sore. Okay.
And that one there,
That one there as well. Okay, let's have a look at this one. And the problem with your ankle, it started at the same time as well?
Yeah, it started swelling. In fact, it was worse than that, slightly going down.
Okay, can I check your blood pressure as well? Have a quick listen to your heart and your lungs. Just gonna have a listen from the back. Just breathe in and out for me. And again. Okay, thank you. Right, so looking at your hands and joints, obviously, I mean, we know that they're swollen and they are sore, okay? I mean, we've talked about osteoarthritis, which is more wear and tear. But with this kind of presentation, what we worry about is a different type of arthritis.
Right.
Okay? Something like rheumatoid arthritis. Have you heard of that?
Yes, I did,
Okay.
yeah.
And that is kind of arthritis where your own body kind of starts attacking your joints and things. And usually it happens in the small joint of your hands. Okay? So I'll give you some medications to help with the pain and swelling. Okay? And we'll arrange for some urgent blood tests. Okay? And then we'll see you back with the results of the blood test.
Okay,
Does that sound okay?
Yeah,
Right?
fine.
No worries. I'm going to give you a short course of naproxen. You take 1 3 times a day for 2 weeks. Okay? There you
Thank
go.
you.
All right, thank you very much. Take care.
Bye-bye.
Bye.
Good afternoon, the Ridge Medical Practice, Veronica speaking. Hello, can I help? Hello?
supposed to be going out on Saturday, this Saturday. We're doing like a brunch thing where you pay 25 quid and you get brunch and you get unlimited Prosecco for about an hour and a half.
Shut up. Anybody home?
And mojitos.
Mojitos? Oh, I've heard rumours about them. They're supposed to be nice.
Oh, she's gone.
So we expect it to bleed a little bit as I take it off. That's not unusual.
What are you doing this weekend?
Playing football.
Oh, yeah.
Good lad. Do you play for a team?
Yeah, I play for Westwood.
Oh, okay.
I just started playing for Bradford.
Have you? Yeah. That's pretty good, isn't it? It's got a really loyal fan base, hasn't it, Bradford City?
Yeah, because they're not doing very well at the minute either.
No. It's up and down with them, isn't it? That's the thing. My sister is the Bradford City doctor. Yeah. So she might see you. Well, hopefully not. Right, should we put that in the pot?
Yeah.
It's off.
Gosh.
There we go.
You all right, Mum?
Yeah, I'm fine, yeah.
We're nearly finished now. They go pretty quick, don't they, Nathan, these things? Right, should we have an absorbent dressing, similar to the one that he had on before? Yeah, that's fine. It's come off beautifully.
Good.
There'll be a little black mark where it's been. It'll scab over, fall off a couple of weeks, and he should have a nice, healthy kind of... Might have a little white patch, but nothing more than that. Looks
So do
good.
I need to keep it covered then now or not?
Keep it dry for 48 hours,
Yeah.
and then you can take that dressing off in a couple of days, and it should be fine.
Fab.
Cheers, Nathan. Well done, mate.
Thank you.
How can I help?
Since, well, Saturday when I woke up, I felt like I got hit in the head by something. I'm very disorientated.
Yeah.
My throat glands over here, they're all swollen.
Yeah.
When I wake up, it's like I'm severely dehydrated. My tongue's just like sandpaper, literally. And I don't know if you can see my fingers as well. My fingers became like that. And then this finger, all the pus has come out of it today because I bent it, but I can't bend it. Now I'm all right because I've been taking paracetamols and ibuprofen, but I've been waking up every 3-4 hours at night because I need to take stuff because my back, my waist, my legs, even last night, I rang my brother, he was only in the next room. I woke him up and I said, please just go downstairs, I can't even get up. I need painkillers.
Yeah.
I've not been able to go work for the past, this is the 3rd day I've been off now as well.
Okay.
I've got a picture actually of my hands as well. You'll be able to see yesterday.
Is your throat still really sore?
Yeah. I don't normally take pictures, but
Okay.
you can see.
So were a few like that with that sort of pustule?
Yeah.
Like that? Just appeared. Okay. Do you work with any chemicals or anything like that? What do you do?
I'm in IT.
Okay.
I work for an agricultural company, so they do develop chemicals and stuff.
Right.
I don't know if
You don't get involved with touching chemicals?
I
though,
don't get involved with touching the chemicals, but I am in the plants and the labs.
Okay.
And then on Friday I was in a few labs. I don't know if it's something I may have breathed in.
I spoke to 111 and they told me I have to come in straight away.
And what are the symptoms?
Oh, I've got a very, very sore throat.
So I also feel maybe a little bit feverish.
Chesty. Are you actually coughing up?
If you just take a gulp for me.
I feel like my throat is swollen, not sore.
Stick your tongue out and say ah. Ah. Say ah. Yeah.
Cough, cough. I feel my throat all the sore.
Anything else with it, or just the sore throat?
A cold?
Yeah. You've got a bit of a blocked nose, I can hear it, yeah.
When I kind of blow my nose, there's a kind of a funny feeling in my ear.
It's so painful that I can't even, like, touch it.
It's constant.
Every time I swallow, I get, like, the headache.
What we're going to do with you, eh?
That's fine. All right. Nice. I'll keep an eye on you, honestly, until we sort you out. Thank you. All right.
Appreciate it.
Oh, yeah. It's red, isn't it? Yeah, that looks pretty sore. I'm just going to relax and say, ah.
Ah.
There's some white spots going on back there, too. Okay, and you said you felt it painful under here. Let me see if there are some glands. Okay.
Yeah, right there. I don't know if you could feel it.
Is that painful there? Yeah. I can feel those. They're not huge, but they might be painful. Yeah. And these have all kind of almost gone, as you say, still a little bit under there. You need an antibiotic for tonsillitis, pharyngitis there, and I'll give you something that will just finish treating what seems to have been an infection with these pustules here, okay? Are you allergic to any medicines that you know of?
Only penicillin, but that's when I was a kid, I don't know.
No, it's all right. What I'm giving you is what people who are allergic to penicillin would have anyway, so that's quite good. So all these other symptoms, like the aching all over, the eyes feeling heavy, feeling hot and cold, leg pain and everything, it's probably all related to the infection that's caused that throat. It looks like what we call a strep throat, streptococcus, that's caused that infection, and that can cause quite nasty infections, sometimes even nausea, vomiting. In terms of work, you know that you can self-certify for up to a week, so just keep in touch with work like you have done, and you probably won't feel quite up to going back for a day or two. Hopefully the antibiotics will work pretty quickly, and when you feel able to go back to work, okay, good, okay. Right.
Okay, that's
all right.
All right, thanks for your time.
Okay then.
See you later.
Bye-bye.
Bye.
How can we help?
I'm having blackouts. It's like I feel really down, and then if I eat something sweet, that's okay, the energy comes back a bit. But some days it's like yesterday, I couldn't even get up.
So just describe to me what happens.
I don't have to be doing anything, and my heart kind of sinks, and then I just completely get a If I'm not getting a blackout, I'll definitely need a drink or something. Something sweet, and then I'll come back, but then it's like my brains are half as... It just takes time, or like yesterday, I had a complete blackout.
So you get a sinking feeling in your heart, and then do you feel a bit faint?
Yeah.
Yeah. And does it come on suddenly?
Yeah.
You also said you've been feeling a bit down.
Yeah.
You're feeling fed up, low in mood.
We've had 2 funerals. My both uncles have passed away.
Oh, I'm sorry. Who's at home with you?
My children.
Just your children?
Yeah.
You don't have a partner?
I'm a widow.
Yeah, yeah. Should we check you over?
Yeah.
So?
I went to hospital on Monday and saw Dr. Shaper, I think, or Mr. Shaper.
For your legs, yeah.
And I'm just freezing. If you feel me, I'm just absolutely from top to... It's just like ice.
Yeah.
And he doesn't think he can do anything for me.
Did he say what he found? Did he say they were abnormal, the pulses or anything?
No, he said they were all right. I'm sure he did.
Well, it's ruled out one potential cause for it. So the blood flow to your legs, the big blood vessels, the ones that carry the pulse, are OK.
Oh, good.
So that is good news.
Oh, that's brilliant.
It doesn't mean that the tiny, tiny blood vessels that go to your toes and to your fingers, they could still be...
I mean, just feel my hands.
They are cold, aren't they?
My feet are cold.
I remember, yeah.
I'm so fed up.
OK, that's good. So there's no drop in your blood pressure when you stand up? You didn't feel dizzy then when you stood up? No? Good. So with any of these do's, is it usually when you're sitting and watching TV, or have you actually fallen to the floor?
I have never fallen to the floor, to be honest.
I wonder if you're a bit low and fed up in mood, and whether or not this is contributing to some of the symptoms you describe. But you also tell me that you crave sugary drinks. Part of that may be because you go in fairly long periods of time not eating very much, yeah? But a few things I'm thinking right now. I think we should check your bloods. I think we should check them for anemia, and I think we should do the diabetes blood test as well, just to make sure that there's nothing medical underlying this. So let's do those blood tests. Let's see you back again with the results. In the meantime, try and get some good sleep, good rest. Try and get some exercise in the day, so fresh air, doing some walking, yeah? But I also want you to think about your diet as well, and eating perhaps more regularly. You don't have to eat big meals, but just eat a bit more regularly, OK? OK, there we go. Ask at the front desk if you can have a blood test.
In
OK?
here?
Yeah. And let's see what it shows.
That's fine.
All right, my love.
Yeah.
Thank you.
Take care.
Thanks a lot.
Bye-bye.
Bye.
Amy, I'm going to put something to you, and it doesn't mean we're going to do this, but I just want you to have a think about this. What would happen if we never got to the bottom of all of this stuff? How would you feel?
I want to finish my autobiography.
We're all waiting for that autobiography.
You know, so I've got to... Sometimes I sit and I think to myself, I'm just lazy.
You're not lazy. You've got some symptoms that are very real and are getting you down. Sometimes when we investigate patients with multiple symptoms like this, often they're very real, but we don't know why they're happening. It might be getting to a point where we say, we've investigated it all now and we've seen people, and there are some things that we are doing for the eyes, the joints, but some of the other things may be a case of, right, I know I've got this, I have to learn to manage it. I've got this book to write, and I can't let these things stop me anymore.
No, I'm strong, I can.
You're very strong. You've been through a hell of a lot, Amy, in your life, haven't you? That's why you're writing that book.
I have, love.
Yeah.
I've got to enjoy life.
Enjoy life, and don't let this hold you back.
Now, what do you think, girls?
Doesn't that sound good? Yeah. Right, so I'll send you out an appointment to see me in a couple of weeks.
I don't know how this doctor puts up with me.
Oh, no, I like it.
Anyhow, all the best, and bye-bye, love. And it's been a pleasure to see the two of you.
OK, Amy, I'll see you in a couple of weeks.
That me done then?
Yeah, that's you done. Thanks very much.
Thank you.
Ta-da.
Bye-bye.
All right, you take care. All right, bye.
Bye. Bye-bye, darling. Beautiful.
Thank you.
See ya. Bye-bye, love. See you tomorrow. See ya.
Good morning, the Ridge Medical Practice. Vicky speaking.
So you stuck your finger in a coffee grinder or something?
Yeah, but do you know, I was so calm. Everybody was really shocked with me, yeah.
So can you count backwards now?
5 before.
Yeah, then before that?
3. 1.
Okay.
Right, that's the worst bit over. Now you can sit back and think about plutonium. Is that real? Isn't that just from Superman?
Kryptonite.
Kryptonite.
Krypton's real.
Can I have a good feel? Is that right?
And she's all there, and you can hear, not being awful, and hear.
You've had bladder cancer, you've got no bladder, you've had a massive polyp removed from your bowel, you've had meningitis, you've had heart attacks. Let me tell you something, your diabetes is perfect. Oh my God, Karen, guess what I had in my bathroom again today? Another giant spider.
And Mia, they're not going to hurt you because it's cold out.
I like spiders from afar. It's like I like tigers, but I wouldn't want a tiger in my bathroom.
Ooh.
Hi, I'm Linda Eves. How can I help?
I've just started last couple of weeks with having quite severe dizzy spells. If I'm rotating my head, I get quite dizzy.
Okay.
Yeah, it's just causing me some issues.
Yeah. It sounds a lot like benign positional paroxysmal vertigo. Have you heard of that, BPPV?
No.
Okay.
No,
it's
it's a good one.
thing,
Yeah,
isn't
well
it?
done. Yeah.
Classically, it's sort of rotational movements of the head. It can be looking up or down or turning your head to one side, and it tends to then set off this sensation of spinning or turning or unease. Is your general health good at the moment?
Well, I've just done the Yorkshire Marathon, so
okay. Well,
I got around there okay, so I think I'm okay.
You're okay. Let's check your blood pressure. It's fine, no problems with that. 122/80.
Yeah.
Just tilt that slightly that way. Great. Okay, well, there's nothing in the ear canal that's causing any increased symptoms, and there's no signs of infection or anything. So if you're happy for me to go ahead, I can do what's called the Epley manoeuvre. So in the semicircular canals in your inner ear that are responsible for how you orientate and so on, they can get some little tiny crystals that form in there, which when they move over some little hairs with fluid, they create a sense of imbalance.
Okay.
And so the repositioning techniques help that.
Okay.
Right. Ready?
Yeah, ready.
Okay, down you go. Okay, keep going, head over the edge, right down to the back. How do you feel?
Yeah, it's just wobbling a little bit.
Sit yourself back up. Have you noticed at home or whatever, if there's one... Okay, that's worse, isn't
That
it?
did it, yeah.
That did it.
Morning, Katie. I'm Debbie. I'm a nurse practitioner. Who's this lovely lady?
Mummy.
Your mum. All right. And I've got Andrew here who's learning to be a doctor and he's just watching us today. Is that okay? Right. What can I do for you?
Since like probably Friday time, she's had this rash on her cheeks, like all up her arms, all on the legs.
She's not been poorly?
No.
Not poorly?
But she was really hot this morning.
Right.
She's had some paracetamol and she seems okay.
Right, so this is the thermometer and I'm just going to check your temperature now. Is this rash itchy?
She had been scratching it a little bit on her face, but not that itchy, is it?
No, it's a funny little rash, that rash on your face, isn't it? It's a little bit blotchy.
Yeah.
Have you got a sore throat or anything?
No.
Can you do a big wide mouth for me? Say ah, stick your tongue out. Say ah. No cough, nothing at all. No. Can I have a look at your belly?
That seemed all right. It was just like her arms and legs. It's gone a bit down on her arms
now.
now.
You can see there, can't you? Was it, when it were bad, were it raised?
No.
No, just like this. Every rash we get, I mean, I can tell to look at, she's not poorly, but we do the, you know, where you talk about the glass test, we just pull it like that and you can see that this rash goes completely. Well, you're a mystery, aren't you?
You are.
That's part of your charm, isn't it? There's a little bit on this on her face that looks like a thing called urticaria, which is just a rash that people get, and often they're a response to a virus. We don't treat it, we just say, see how you go, and you can take some antihistamine if you need it. She's well, and that's the main thing. It's coming and going, because it's gone, you know, from her arm, so I think it will settle. It might take a couple of weeks, all in all, but bring her back if it gets worse. Bring her back if she's got any other new symptoms.
Back to school tomorrow then.
Back to school tomorrow, but today you've got our permission to lay on the sofa, get telly on, get your feet up and let your mum run after you a little bit. Is that all right? I love your glasses. You look so brainy in them. Are you brainy?
You are.
You are, I can tell.
Clever clogs.
Okie doke. All right then.
Lovely, thank you.
All the best. OK, don't any worries, you know, just bring her back if it gets worse. See you later then, chick.
Hi.
Have you ever had your hair cut?
She had it cut quite short, about up there.
Long.
And then she decided she wanted to grow it again,
Oh, it's beautiful, isn't it?
Yeah.
Let's have a look. I'll be touching your bottom next time we see you.
Oh, that's what she's hoping for.
See you later, love.
See you later.
See ya.
Are you ready? Okay, so lie yourself back. Okay, right over here. How do you feel?
Yeah, that's doing it.
That's doing it, okay. Turn over this way. Tell me if it sets it off.
Yeah.
Yeah, oh.
yeah, right. And it's normal again now.
Okay, keep turning your head a bit further over. That's good, stay in that position. Turn your head a bit further forward, that's perfect. Are we okay like that?
Yeah, I'm good, yeah.
You're good. bring your knees forward, so what you're going to end up sitting forward facing my desk. Okay, how are you doing?
Yeah, I'm pivoting side to side rather than going.
Okay.
Rather than it being dizzy. That's it, settle down.
Settle
now.
down.
Yeah.
That's quite quick. We'll get you back over in the chair.
Yeah.
You all right?
Yeah, good.
Okay, up you get then. Okay, keep looking there. Round over here. And sit down. Okay. You can't drive when you've got symptoms of vertigo, so looking over your head and so on. Hopefully, with this repositioning now, things will be quite a bit better.
I think I'm at that age when I'm collecting things now. So it's, yeah, the eyesight went last year. The,
did
the
it?
ears
Yeah.
went 2 years before, so it's just waiting for the next thing.
How you doing?
Hi.
Not bad.
Like your waistcoat.
Holds my tummy in.
Oh, yeah, can I have one?
I use it as a corset, if I'm honest. When I get home, I go.
That's very nice.
They contacted me upstairs because they said you were really poorly and needed to be seen urgently.
I've been in hospital for 9 days. I just come home yesterday. But what it is, I can't keep knocked down and I'm in agony.
OK, let's go back a bit. So tell me about what happened. Ended you
Basically,
up in
when I
hospital.
went in hospital, I got up that morning in bad agony like I usually get. And then I started vomiting up white brown stuff and blood, pure, like red currant blood. I hadn't been at the toilet for like 10 days.
OK.
And then he thinks that I've functional dyspepsia with my stomach, but they want do some tests to check the nerve endings. Because also they were worried it might be gastroparalysis.
Yeah.
But I've just been in really bad pain and I can't keep knocked down.
Don't worry, we'll be able to help with all that today. I just want to make sure that you understand what all those terms mean.
I know they explained a little bit that if it is gastroparalysis, it's basically where your stomach becomes paralysed because of the nerve endings.
Yeah. You are right with gastroparesis, where it means that the stomach isn't moving things out of it down into the gut very well, and that can lead to food being there for a while, which in turn leads to more acid to try and digest that food. And dyspepsia is just a posh word really for acid production, over acid production that can come up your food pipe and cause all sorts of pain and problems there. Do you mind if I have a feel of your tummy today?
Yeah.
Is that okay? You're able to come up on the couch. Who's looking after the children while you were in hospital?
My partner.
Okay. How are the kids?
All right, yeah, they just missed me.
Oh, I bet. Right, I'm just going to lift all this up. So just bear with me, my hands are a bit cold.
Okay.
You're very sore, aren't you? Is this how sore you've been all week?
I've been like this for 9 days.
I'm just going to have a listen into your bowels, OK? When was the last time you had anything to eat or drink?
Yesterday.
And you said you haven't opened your bowels for how long now?
10 days.
10 days. Do you feel like you need to go and open your bowels?
I just feel like there's a lot of pressure there, like I do need to go, but I just can't go.
When they did the camera test up your back passage, did they tell you that you might be constipated or anything?
You could see there were a lot of poo there.
Was they? OK.
Yeah.
OK. Come off there and we'll have a think about things.
Well, basically, I come today to see if we can get a bit of anti-sickness off you because I can't keep knocked down.
I think that's fair enough.
And I'm losing a lot of weight. It's like when I was in there, I lost £2 from the Saturday to the Saturday, and then in past 6-7 weeks, I've lost over 1.5 stone as well on top of that.
OK.
So they're really worried it's going like to a dangerous weight.
Severely underweight.
I feel weak.
Yeah. What we'll do today, get you on some anti-sickness medication. I know you're on the pantoprazole already, I want you to stay on that, but I'm going to give you something else to help form a coating over the lining of your stomach. I'm just a bit worried that if you don't open your bowels in the next 2 or 3 days, we might need to think about giving you an enema to try and move
I've had
it.
enemas up there, and neither of them worked.
Well, what I'll do, just to try and get things moving a little bit, is give you some little suppositories that you can use yourself morning and evening time. Does that sound all right if we do those 3 things? Anti-sickness, something for a coating on your tummy, and then something to help.
Yeah, they're the little bullet phones out there.
They are, yeah. They're not very pleasant, but they'll help.
It'll help, yeah. Oh, it's better than having what I've got right now.
Yeah, I know. You look like you're struggling there.
I am. I'm in pain. I've got no energy or nothing.
Oh. Well, why don't I arrange to see you in about 2 weeks' time?
Yeah.
And we can weigh you, see how your pain is, and make sure your weight isn't dropping any further.
Yeah,
I'll send you
brilliant.
that appointment out so you don't need to worry about that.
Yeah,
All
thank
right.
you.
OK,
Doctor.
my pleasure. Now, I believe you've got something on your finger to show us.
I have.
Does anybody put a finger and how to feel of your prostate?
And like there, it's like the skin peels off. It's like it's burning.
I just can't put my finger on why his blood sugars have gone up.
Oh, come on, Hannah. Stop it.
He's going for it,
He just wants to bite.
Can you just follow my finger with your eyes?
Well, work sent me on because, you know, it's too dangerous. I've already lost a finger, you know, in the machine.
So he chopped his finger in the car bonnet?
All right, I'll speak to you then. Fingers crossed.
I was just reading about your finger. How are you?
I'm all right within myself.
So, is it painful?
No, not really, no. It's not painful. Only if, like, I accidentally hit it off or something, then it really hurts, but...
And can you bend your finger okay?
Yeah.
Yes?
Yeah.
So, is it just the top?
Yeah, it's just the top end. They've given
Did
me...
you have surgery?
No. I didn't go ahead with it because they said to me I could either have the surgery or not, just let it heal. So I just said there's no point doing it.
Sure.
They've given me this dressing.
Now, are both those dressings on now?
Yeah.
My goodness, you must have gotten a shock.
Yeah, but do you know, I was so calm. Everybody was really shocked with me,
You were the calm one?
I was really calm, yeah. Everybody else was, like, flapping everything. I was really calm.
So what kind of surgery would they have done?
Basically, they would have cut it down, cut my bone down, cut it all away and shaped it off. Because basically what's going to happen now is once it's healed, it's not going to be healed rounded, it's going to be healed flat.
Right.
So it'll still have the length, but it won't have the shape.
OK.
Whereas if I'd have had the operation, it wouldn't have the length, but it'd have the shape.
OK. So you stuck your finger in a coffee grinder, is that correct? Yeah. Oh, you took it off? Oh, well done. Now, how does that look to you? Because I haven't seen that before.
Oh, it looks really nasty. Well, the scabs come off. It's not very nice.
My goodness.
Disgusting, isn't it?
No, it's healing. It's healing. Did they say that it would eventually just take time?
Take time, but it will heal eventually, and my nails should grow back as well.
Were you in a lot of pain?
No, it wasn't painful. It was more like a throb.
Oh, a throb.
Here and there, it felt like a little needle just poking it.
OK, so this goes this way?
Yeah.
Up.
Yeah, it goes like that, yeah.
Are you right-handed or left-handed?
Right-handed, yeah.
So do you find it really...
Difficult with it, yeah. But it's not too bad, really. My scabs come off, and I'm happy about that.
I'll give you an extra bit of this, just in case.
Yeah. It's lovely.
My goodness. There you go.
Lovely. Thank you very much.
Hello, this is Lorraine Donnelly.
Yeah, love.
Hello, like to come and take a seat?
Yeah, love. Oh, I need it down this side.
Say that again, sorry?
Me thingy down this side.
All
so
right.
do you wanna?
Yeah, so let me, tell me that, so is it a rash that you've got, sorry, so...
I was bad under me red and sore.
Red, OK, yeah.
Under me and in my groin.
Yep, down below, yep.
Yeah, down below. But this side were more bad. It was like blistering and like a little abscess.
OK.
And it was bad. This is all cleared.
Yeah, all good.
Apart from...
Down there, yep.
So when I was getting a nice shower yesterday, last night, it was gunging and...
Not very nice. OK, yep.
Not nice.
OK, OK, yep.
Yeah, so... I could have seen a male doctor, but I'm 62 years old and I feel a bit embarrassed.
Yeah,
you know what I mean?
fine.
I know it's their job and they don't, but
no, we understand. We understand that. And how are you feeling yourself? Feeling hot, feverish?
My face, all here sweats.
Right.
Right, all the way down, all on it. And the only time it don't sweat is when I'm not so well. And look, I'm not so well.
And you're not sweating?
No.
Should we check your temperature then,
If
just
you
to
don't
make sure
mind,
it's all right? So we're doing this here.
Right.
Yeah, that's perfect. That's good. So should we have a little look down there? Do you want anyone else in with us? So one of the
You're all
nurses, are
right.
you happy for me just to have a look?
If you want to bring somebody in...
No, I don't mind. It's really up to you. Whatever's
It's up
comfortable
to you.
for you.
If you want to bring some...
Yeah, no, that's
Right
fine.
then.
Do you want to pop yourself on there?
Yeah.
Sorry, the bed's a bit of a...
It's all right, darling.
So what I need to do is just... Are you able to pop everything down for me? Just let me know when you're ready and we'll have a little look.
Yeah, I'm right. I'm ready, lovey.
OK, I'm just going to pop some gloves on.
Right, lovey. It's in... Oh, God. Oh.
You all right there?
No, I'll have to sit up a bit more.
Do you want some help? Are you OK?
Could you just lower I this up a bit?
That'll be all right, yeah.
Right.
There, can you see it? Yeah. It's there.
And did you say there was some gunk
Yeah,
coming
it's
out
a
of it?
bit, yeah. There. And she's all there, and you can hear. I'm not being awful. And here.
Can I have a good feel? Is that all right? I just want to make sure there's no lump or anything there. I'm really sorry if it hurts.
There was a lump there, and I explained it. But further down, he had like down that bit, where that bit down there, it was a lump.
All right, you can get yourself dressed.
All right,
All right, shall I help you up with this?
Oh, yeah, if you don't mind. Right, I won't be a minute. Oh, thank you.
All right.
Got to get up. Oh, God. Right.
You okay there?
Yeah.
Yep.
Won't be a minute. Because by the time I come, they'll be sick of me.
Okay, so looking at that kind of area, I mean, it looks like the spot that was, seen a couple of weeks ago, it looks like it's popped. So that's what all that gunk was that must have come out. It actually looks really nice and clean.
Good.
So you've still got kind of a bit of that fungal rash still a little bit there, but the infection, or what I think the doctor before thought that it might be a bit infected, so gave some antibiotics. It looks like that's done the job. So we'll have some more of the cream here. Is that all right?
Yeah, that's lovely.
Okay.
Oh, God.
You okay?
Yeah.
All right, then.
Thank you.
Sorry, I've got very cold hands.
Yeah, oh, no, lovely night.
All right.
Yeah,
Bye-bye.
I've got it.
Yeah, I was telling them about my holidays. I said, I've just beat the Corfu. I said, do you remember what happened in Corfu? She went, yes, I do.
Is it a case of what happened in Corfu stays in Corfu? I don't know why we always say that. You must have had a good time.
I bloody did, yeah.
Do you know something, Veronica? You're never miserable, are you?
I don't believe in it.
Good on you, Veronica. Good on you.
Hello. Is it 7 here?
Mrs. Di Francesco.
Yes, I am.
Hello. I thought I'd lost you.
I lost myself. Yeah. Non mi rispondo, I lost myself.
Come in, take a seat. How can I help today?
Well, sometimes I have a terrible headache.
Okay.
And I get a pain from here. It go. I know I worry too much for my husband, Paul. Anyway, very poorly.
So you're always worried about him.
I have too much trouble in my house. Too much.
Why?
Because he said, you lost Rita. You're going to lose it, you lost it. Because I've done it twice. I work, I reach in Bradford. I say, oh my God, what happened now?
Oh, so you lost your memory?
Yeah, because I'm suffering so much from my husband.
Does the headache come on every day?
I have every day, just sometimes from dun.
Yeah.
I say, oh my God, what's happening? And he gone.
Okay. When was the last time you...
Because I suffer so much in me, that's all, because I love my husband.
I understand that.
And I see maybe day by day he can die.
Yeah, no, I understand that. But the thing is, let's talk about you today, okay? Because you spend so long looking after your husband that we also need to look after you, okay?
Oh, lovely.
But let's just go through your memory. I'm going to ask you a few questions, which might sound a bit silly, but it's just to test your memory and see how it is.
Lovely, testing me everything.
Right? Okay, we'll test. So what's the day today, do you know?
Just a minute, I don't remember now.
It's okay.
And my husband told me as well and forgot. That's it, that's my...
So you're forgetting me like that. Okay, don't worry. Let's go with something a little bit
Maybe my head go crackers.
No. Well, I'll tell you when it goes crackers, okay? So don't worry. So can you count forwards from number 1? So number 1...
From the U, yes.
So 1?
Number 1, 1, 2, 3, 4, and 5.
Good. So can you count backwards now?
5 before.
Yeah, then before that?
3. 1.
Okay.
1, 2, and 3.
Oh, for me? Oh, thank you.
Oh, Shirley, my cold is killing me. No, you'll catch it. Don't catch it.
Oh. Yeah, she's gorgeous, ain't she?
Hello.
Oh.
Right. Lovely to see you, Mr. Gibson.
I'm sorry, I'm sweating.
Oh, don't worry, so am I.
All right.
Come here. You're so clever.
I can see that obviously the memory is sometimes a bit weaker, isn't it? And that's why you forget sometimes where you're going and if you put things down.
I'm very...
How long has that
Sometimes
happened?
I go downstairs to cook it.
Yeah.
I forget. All my pan come... I smell, you know, because it burn. It's too much of this.
How long has this happened?
It's more than 2 years.
I think we need to get it tested and checked. What do you think?
If you help me, I will go in paradise.
Who do you have to help at home?
I go to the nursery with my husband.
So let me just ask you a question then.
Yeah.
Do you ever forget to lock the door?
Too much. Me forget all about.
Okay, because I think you might need some more help at home. So help with like maybe making the locks more secure, helping with the cooking and things like that. Well, what I'll do is I'll arrange the blood tests, but I'll come out with you and we'll arrange the appointment together and we'll make sure that you get a card so that you don't forget it.
Oh, lovely.
So let's go outside and we'll book the appointment for your blood test.
Oh my God, I wish you
You're lovely, don't worry.
You're lovely.
It's going to be fine.
You're lovely. I see a lovely lady today, my God. Nice and gentle, it doesn't make people look better.
Don't worry, we're just going this way. Come on.
Yes, all right.
Right, how are you doing?
Not that good.
Really?
But I'm doing good myself.
Okay.
I got back on my anxiety medication recently.
All right.
I just wasn't doing too well, but back on it now, feeling 100 times better.
Good.
My skin has got worse.
Has it really?
Like under my boobs is really bad, and my legs are quite horrific again.
Oh gosh, because we tweaked your lotions and things, didn't we, last time?
It just made it really painful. Like my skin cracked a lot.
All right, I'm sorry that doesn't work for you.
Oh, just hit and miss, isn't it?
Well, unfortunately, yeah, that's often the way of it. So what works then? So the moisturisers you're putting on regularly?
And sunbeds.
And there's some, right, OK. Us in the dermatology fraternity aren't big fans of sunbeds because, you know, but I can see why people like them because it can help. Right, would it be all right to have a look at some of these areas now then? Let's have a look.
These are like the worst.
Oh, yeah.
So that's quite, like, they look like bruises now, which is quite scary.
Yeah, so there's a lot, I mean, I can see that that's difficult to put lots of the creams on without getting it on the healthy skin and things. I mean, it's a little bit dry, isn't it, in some places? Yeah. OK. Like all skin conditions, it's all very subjective.
You can never find a cure, unfortunately,
Yeah, unfortunately for psoriasis there isn't. And it's very much how much the skin's bothering you to know how far we go with different treatments, because most treatments and things, like you found with that lotion, unfortunately, can irritate, can make things a bit worse before they get better. So it's very much up to you. I mean, what are your thoughts?
I would like to try maybe something else if there's something you can recommend.
OK, yeah. Steroid for the redness we could try. We have to be slightly careful about how strong we go, but we can give you a steroid cream and then put some moisturising cream on all over, because I think that will help.
Will it ruin my tattoos?
Shouldn't do.
I paid a lot of money for these.
It shouldn't do, it shouldn't do. Well, why don't we just go for one thing at a time, maybe? Why don't we go for this, Humavate? You're going to increase your moisturisers, and then we'll see you back, and we'll see how things fare, OK? And I've just put this on once a day, and I think you mentioned when you first come in that your mood is better, your weight's coming down. Both of those have a positive effect on the...
I'm on vapes now.
Oh, fantastic. So there's three good things that will probably improve psoriasis.
Yeah.
You know, certainly in a lot of people, if those three things are improving, then psoriasis does get better. So, well, I'll give you this slip.
Thank you.
You know who I am, don't you, Dr. Caris?
Yes. I refuse to see anyone else.
Yeah, oh, that's nice, thank you.
Well, thank you so much. Have a lovely day.
Okay, good luck with everything. See you later. Bye-bye. I mean, she's nice. She was positive, isn't she? And that's got a massive effect. If you can cope with your skin, you're going to do so much better. You know, I mean, how bubbly was she? It was lovely.
Everyone's got nicknames for me. It's amazing.
Nice one.
Beth and Lorraine call me Ebbers.
Ebbers.
Assad and Ruth call me E-Bonnie. My mum calls me Ebby, Ebbs. Idiot.
Okay.
No, my mum doesn't call me that. People just go, bloody idiot.
Take a seat.
Hi, William. Hi, I'm Dr. Khan. Nice to see you. Come and take a seat. Right, I'm seeing you for your left toenail. Is that right?
It's right.
Ah, OK, right.
The left one was done a couple of weeks back.
Let's have a look at it, shall we?
It's this side.
Yeah. OK, yeah, we'll do an excision of that side there. Right, hop onto the bed. So what do you do, Will?
I'm a Student at the university.
How are you? What are you studying?
Chemistry.
What do you want to do with your chemistry qualification?
Well, I'd hope to go into something like the atomic weapons establishment.
Oh, wow.
Go into that sort of stopping nuclear proliferation.
Stopping it? Good idea.
Yeah.
We like that.
Wow, we've got a right.
I know.
I'm going to be like this now.
I mean, we were talking about GCSE chemistry
Yeah.
before you came in. It's not really the same level,
My
is
mind's blown now.
it? Like Bunsen burners.
Yeah.
It's all right, I'm a medicine enthusiast. I tried to go into it, but did not have the A levels.
You're too clever for medicine. I mean, I'm taking off a toenail, you're going to be saving the planet. Right.
I don't like needles.
Right, don't worry.
Right, here we go, William. All right.
Okay.
Sharp scratch, sorry. Well done, mate. It's going to sting now. I know.
God, it's so awful.
I know, I know.
Hello, come in.
Hi.
I'm Dr. McFadden. This is Harrison, our medical student. Have a seat. Right, my love. So, you're here for your knee injection.
I am.
You are. Which one do you want doing today? Because we
This
can't do them
one.
both at the same time. The left one's worse than the right, yeah?
Yeah.
Just out of interest, are you right or left-handed?
Right.
Harrison and I have been talking this morning. We've been trying to work out if you're right-handed, does that mean you're left-footed? Do you know? I don't know.
I don't think it does.
I
Does that mean that when I go for a walk with a dog, which one I start off with
Yeah.
first? Yeah, I usually start with.
Do you? So you're left-footed
yeah.
and that's why your left knee's worse? Pretend you've got a ball in front of you.
Yeah.
Which foot would you use to kick the ball? But
If I were Harry Kane, I'd probably be all right, yeah.
If you're
with
gonna
left
walk-
leg, but when I'm kicking a ball for him and getting a goal, you know, going, hey, Bowser, you know, Bowser, whoa, catch this ball. I can send him halfway down Wibsey Park with the right leg than I can with the left.
Brilliant.
Yeah?
In your own time, can I ask you to come and sit up here, please, my love? So this is a great knee to look at.
Yeah.
Is there a point in your knee where you struggle with it the most? Is it, or is the pain everywhere?
It's just there.
Around
That's
there.
it, round there, nowhere else there.
On this, yeah?
Well, I had cancer last year, and I had a breast cancer tumour removed.
You did
last
not?
year.
Gosh.
I did, yeah.
Right, so you're looking after yourself now.
Taken out in this year as well.
Okay. Right, so you understand the importance at the present time of looking after yourself. That's
yeah.
Brilliant. Tell me about your dog.
My dog is 95% idiot, 5% staffy.
Ah, girl or boy?
A boy.
Nah. Brilliant. There we go. We'll have no blood, but just remember and wipe your X marks the spot off later, or people will be digging in there for pirate treasure.
Oh, yeah, I'm sure. Bit of uncharted, eh?
Absolutely.
Right, that's 1 out of 2. Here we go, 2 for 2, and then we're done.
God, I think I'd prefer if you just did it without
Oh, no, I
antiseptic.
don't think you would. You okay?
Yep.
Is it going a bit numb now?
You done?
Yeah. Right, that's the worst bit over. Now you can sit back and think about carbon, lithium, what do we know? Plutonium, is that real?
Yeah.
Isn't that just from Superman?
Kryptonite.
Kryptonite.
Krypton's real.
Right, close your eyes, Will, and tell me what if you feel pain.
I can feel it, it's not painful.
Well, I think we should start because a bit of pressure is fine to feel, but if it gets sore or painful, let us know. We'll put a bit more medicine.
I'll tap out.
Right, here we go.
I can hear that clipping.
Don't think about it. Think about nice things.
Have you specialised?
I do a few different things. I do this, I do diabetes mainly, lots of teaching.
Have you got a title yet?
I am an honorary professor. Right, you're all done. Not too bad, eh?
Put your lovely bandage on now.
Right, Will, I'm going to leave you with Karen. Pleasure doing business with you and good luck.
Thank you.
I expect the world to be a safer place after you qualify.
Yeah.
They do screen, you know, of the frogs.
Becky, don't I feel sick?
They do. Honestly, our cat once caught one, and I went out and you think, oh my God, what's that screaming? And it caught a frog.
I thought they just rib it.
No, it proper screamed.
And what was the cat doing to it?
Well, it got it in his mouth, but it was a bit rubbery for it, you see, so it let it go eventually.
Oh my God.
Well, we're having a disaster today. I don't know how much the receptionist will have told you, but the computers, they haven't been working at all. In that I can't log on at all.
Just relying them at me so much, and when they go wrong.
Oh, I'm maligning them today, I tell you.
Okay,
Yes, thank you. Come and have a seat.
Thank you very much.
I'm Dr. Moncrief.
All right, okay.
So I'm going to try and open it up.
Right, okay. This could take some time.
But it's already got its little egg timer, which means nothing's happening. So I think the best thing to do is for us both to acknowledge I can't see anything useful on here.
Okay.
So please, can you tell me what brings you along?
Yeah, I've been to the doctors and I just happened to mention that I got a couple of areas of skin that were a bit odd, really.
A bit odd?
Well, they sort of were sore and never quite healed. And it just, this has been going on for a couple of years, sort of thing.
Couple of years?
Yeah, it's on my face then, I've got one on my leg.
Right.
And they sort of come and go, but they never 100% heal. And this one on my face had been bleeding, it scabbed over.
In the past, have you had any other trouble with your skin at all?
No.
And would you say you've had much in the way of exposure to the sun?
Probably in my youth, I'd probably sunbathed quite a lot, yeah.
So where is it on your face?
So it's just, you can hardly see it on there now.
Thank you very much. So for this one here, it's certainly it's not anything dangerous at all.
Right.
It's likely to be a bit of very early sun damage.
Right.
Yes?
Yeah.
And people worry about that because a small proportion of them can eventually go on to be a type of skin cancer.
Yeah.
So this is a big day for this little one, a big day for you two.
And you're struggling with your knee?
Oh, big time.
And how's your head today? Oh dear, that were a big sigh, weren't it?
Oh my gosh. It's bigger than what I thought it was going to be.
Yeah.
And I believe you've come out your eye.
Doing the garden last weekend, it felt a bit bruised and it's got bigger and bigger every single day.
You show me your muscles. Yeah, Dad said that my muscle was bigger and he was right.
So, are you ready for my big end?
Yes, the big finale. You've listened to me. You know, that's the big thing. I mean, I'm 82 nearly.
I know, but looking gorgeous.
How can I help?
Yeah, so Eva is not feeling well. From yesterday, she had all-night temperature. She was vomiting. How many times you vomiting yesterday?
3.
And what else?
Cough.
Did you have a cough?
Throat pain.
Oh, has he got a sore throat as well?
Yeah.
I'll have a little look at that.
I feel cold.
Do you feel cold? That might be because you're a bit warm. Funny that, isn't it? Let's check your temperature. Great. There we go.
This is sweet.
Good girl. Slightly raised again, isn't it?
Why is it taking long?
Good girl. Okay. Now then, let's have a look in your throat. You're going to go, ah. Oh, goodness, look at that. Just relax your tongue a bit.
It's too big now.
Wow, what a tonsil. Come and see this tonsil. I bet it's sore. Open your mouth. See how big that tonsil is?
The right one.
So it's one really big tonsil. It's also got some white stuff on it, hasn't it?
Is this normal?
It's quite big, isn't it?
Yeah. It's very big.
And it's you're ticklish, aren't you? Try to relax.
She's snoring.
Yes, I should think she does. Is she snort every night or just
Every
now that
night.
she's unwell?
Every night.
Just put your chin up for me. There we go. All right, that's all right. Okay.
Chill out.
How do you know where my chickle spot is?
Let me just listen to your chest at the back, my love. Just nice big breaths in and out through your mouth.
What?
Copy me, copy me.
That's why I can't believe her sometimes when she's seriously sick or not.
Yeah.
Because she's so naughty.
Copy that, and again.
Okay, my love, that's fine. Now I need to check your tummy over, don't I? So would you stand up and come over here for me? Good girl, lie yourself down. Excellent. I knew you were ticklish. Why did I even think this was going to be easy, eh? All right, off you get. There's a good girl. Now, I'm going to ask you a few more questions about this snoring and see if it's something that perhaps might need to be referred for. They do sleep studies. So tell me exactly what you notice when she's asleep. Does she ever stop breathing for a few seconds and then sort of like that? And how long a time is it that she's doing that?
It's like going like this all night, no stop.
Does she always sleep on her back or
She's sleeping every side.
Which way? All right then. Right, let's do that referral now. And here's the penicillin. It's 1 spoonful 4 times a day for her tonsillitis, OK? All right, thank you for coming in. Nice to meet you. Bye.
Bye.
Now, the one on your leg. Yes, that one's much more characteristic. So that one's a bit, as you can see yourself, it's a bit thicker. It's progressed a bit further.
Yeah, yeah.
So none of these is dangerous. The one on your face has got so much better that I think we might well be able to help it on its way just with some gel.
Okay, right, yeah.
This one, the way to be 100% sure would be to have a little sample taken of it, a biopsy, to be looked at under the microscope. Sure. This is not an emergency thing because these are not dangerous cancers, right?
So is it that basal cell?
Yes.
Is that what it is?
The old-fashioned name rodent ulcer. Modern name basal cell carcinoma, which is rather an alarming name.
It is rather, yes.
But it shouldn't be really, because it's not the sort of thing that would spread anywhere else in the body and make you ill. It's not like malignant melanoma. It's not like that at all, at all.
No.
I'm going to have a go at entering this on here, but I suspect you may have to join all your people who've been here earlier, and I've got to write it down. And when it's working properly, I'll have to put the details on the computer and do the letter.
It's a good job we've got a pen and paper still, isn't it?
Well, we can still talk to each other, whether the computer's here or not.
Now then, you. Are you going to smile for your Auntie Debbie today? Are we smiling today?
And as long as I'm mobile and I can keep smiling, I've a chance.
Well, we all got to think like that, haven't we? All right.
Hello. You're a smiler, aren't you?
From my point of view, you're doing pretty well.
Yeah, that'll do. Yeah. Look, smiling. It's nice. It's lovely to see you, Nick.
Yeah.
There we are.
Come in. I'm Dr. Khan. Come and take a seat. How are we doing?
Oh, not bad. I
Not
can't
bad.
complain.
Oh, that's good. Come and sit down. How are things with the diabetes?
Well,
oh, perfect. Yeah.
as you can see, my mornings.
This is the most organised book I've seen in a long time.
It's about all ears organised then.
All right. These readings are really good. Now, your blood test here, as you know, shows us your average reading over the last 3 months, and yours is excellent. It's better than it was before as well. Your average reading is 7.5, so bang on where we want it to be, really.
What about my waterworks? Is that all right?
What do you understand about your kidney function?
Nothing.
Nothing?
All I know is I'm diabetic. I don't have a bladder. I have a pouch.
OK.
I have a stoma.
Right. That goes directly into your bladder?
It's gone.
Into me.
What happened to your bladder?
I had cancer.
Oh, did they take your whole bladder out?
Yes.
OK.
Everything.
Right, OK.
I had a massive polyp removed from my bowel.
OK. Was that bleeding?
Yes.
It took him 150 minutes to remove it.
Wow.
And I watched it all on telly.
Yeah, were you awake?
I was
Yeah.
wide awake. It was massive.
Fascinating stuff.
I've also been in with meningitis because I had sciatica and I went for some injections in my spine for pains in my legs. I got out of bed about 11:30 and I collapsed on the floor and she dialed 999.
Yeah.
And I was unconscious for 3 days.
Gosh. So let me get this straight.
Believe me, Whatever it is, heart attack, started with heart attack.
So let me just get this right. You've had bladder cancer, you've got no bladder, you've got that back
That's
now.
right.
You've had a massive polyp removed from your bowel,
Yeah.
thankfully just a polyp. You've had meningitis, you've had heart attacks. Let me tell you something. Your diabetes is perfect, beautiful.
But he's still got it.
You've still got it.
I'm not bad for an 88-year-old.
Not bad. Well, I don't know. Looking at that list, people might argue with you there.
No, I've got through them, haven't I?
You've got through them and you're still smiling.
Yeah. I know what my mate of now is getting me 2-3 places.
Well, I want to shake your hand because you've been through so much and you are so positive and smiling, even without that tooth. Right, thank you so much.
Thank you very much.
Nice to
Cheers,
see you.
pal. Yeah.
Thank you very much. Cheers, lovely to see you both. Take care. Bye-bye.
Bye-bye.
Which way did we come?
Quicker that way.
Quicker this way?
Yeah, just go around there. Cheers.
Thank you.
Bye.
Can I have that back, please? Hey? What's your name? You got all shy. All right then, see you later.
You're in charge. Give that to the chemist, he'll give you some medicine.
Yeah?
See you later. Oh, I love them shoes. See you later.
Night. See you later. Good night.